Hey everybody, welcome to this week's live with Facial Pain Warrior. And while we're waiting for those to join, we're going to go ahead and get her linked in here in just a second. But we're really excited for today. So bear with us as we get this going, and we'll have her connected here in no time. One moment. Hey everybody, as you come in, we're excited to have Nell with us.
We're excited too, you guys.
Yeah. Another thing is that you might have registered for the event and it wasn't liking a word in the event. It wasn't. I had to delete that and just go live. So if that impacted you, we appreciate you pre-registering. Give her just a few minutes to go live so that we can bring her in. And enjoy the music, which, by the way, is Elevation Worship. And Nell introduced me to them, and it was, oh man, it's my favorite group.
Yeah, you'll fall in love with them.
Yeah, it said it was canceled. I had to. There wasn't.
We don't know.
Yeah, long story short, it's not canceled.
It didn't like a word in the title.
It didn't like a word. I don't think TikTok liked warrior or something in it. So I had to, and it wouldn't let me go live unless I couldn't just edit the sentence and stuff, guys. So nice to meet you as well. How are you, Gracious Colonial?
All right. I can't see the names well from here.
The names come in.
Excellent.
From Kansas. Oh,
hi,
man, we're excited. Yeah, it is finicky.
Ooh, yeah. Test me. I love it.
Oh, you guys, we're so excited. I've been in contact with some people on some things that we're working on, and it's starting to come together. So we'll announce more as we're able to. All right, here we go. Facial pain.
Let me turn it shut down.
Hi.
Hey
sorry
there.
Delay. I had stomach issues going on.
Don't apologize.
That is okay, my friend. You do not have to apologize. How are you doing?
I'm a little nervous, but
okay. That's the last thing you should be. You guys, we have a rock star right here.
Yes. And what's your first name? I mean, I know you as Facial Pain Warrior because your username, but is that, I don't know if you want me to call you that all the time. So,
okay, my name is Jessica.
What's your first name?
Jessica?
Oh, I can't hear you.
I don't know if it's our.
I can hear you now. Try that again.
It's Jessica?
Nope.
Hang on.
Her name's Jessica. Now?
There we go. Can hear you now.
Jessica?
All right.
Go ahead and try that again.
Jessica?
Nope. Can't hear you.
Well, either they know or they're getting it, so.
That's okay. Bear with us while we work through some technical difficulties. It happens.
Welcome.
In fact, once we get her audio up, guys, while she's working on that, I was able to connect with her earlier today when she was on a live, and she was just so excited to come on today. And I was on my way back from lunch, and then we got disconnected there. My internet went. You remember that? So she can hear me, but I can't hear. We can't hear you still, my friend.
You want to?
There we go.
Oh. It's in and out.
Okay.
We get a little bit.
We're getting a little bit.
You're disconnecting all the Wi-Fi.
Oh, you disconnected.
There we go.
Wi-Fi. Okay.
That's working.
Can you hear me now?
Yeah.
Yep.
Hear me now?
Yep.
Okay. Cool.
Yay! Is your name
Alright.
Jessica?
Yes, it is.
Okay.
That is my real name.
Jessica. Oh, it's
Turn
nice to
yours
meet
up a
you.
little bit more.
Yeah, we can hear you, but the volume's faint. So we've got our volume up all the way.
Your
Oh, it
microphone's
is?
in the bottom.
Okay.
That's better.
Hey, you guys.
Right here?
I can hear you, but it's faint.
She's like, I didn't want an up close and personal today.
I know, it's like...
Can you hear
Look.
that? I can hear you.
I've got a little fan.
Do it right now?
We can, but
Yes?
it's really soft.
Yeah, yeah.
What the... Is it my case, you think?
That's
Ooh,
good.
that was
That's
good.
good.
Okay.
It could just be the connection. We're in a rainstorm too. We have crappy weather.
Oh, we're in a rainstorm. Okay.
Oh, that's fine.
Oh.
Of course, right? Of course.
Yeah. If it's gonna happen, it'll happen.
Yeah. All right.
Well, we could still hear you.
So
We'll work with it, and it
Okay.
might get better as we go here.
Mm-hmm.
Maybe short somewhere. I don't know. I don't know if you heard, but it's Jessica.
Yep.
Jessica.
Yeah, and someone typed it in there for us, so thank you, you guys.
All right.
And you know you've
Okay.
got some amazing followers. I've reached out to some of the people that are following you, and just in preparation for this to make sure that we were kind of really given a platform beyond what you're already killing it. With reaching out and helping people, and I've just been overwhelmed with people following me back and being all about what you have been a part of, and it's just another testament to more and more people coming together for something that has just been lacking for far too long.
Yeah.
And so you've been a big part of it. So
I never feel like I am until people say stuff like that. It's
Yeah.
just, I gotta keep chugging along because, if not for me, for other people too.
Yep.
Yeah. And you just forgive my memory, Catherine. That's name? Say your name one more time.
Jessica.
Jessica. Okay.
Somebody there.
All right, we got it right in front of me. Okay, Jessica.
So what was it yesterday, the day before? You got 50 staples pulled out of your head? Or was that was a recent?
Yeah.
Yeah.
She just barely had that happen.
Yeah. So what you have is trigeminal neuralgia.
That's one thing she has.
Is the main issue with your facial pain?
Mm-hmm.
Yeah.
Okay.
It was trigeminal neuralgia that they found out in 2019. That took a long time to get diagnosed.
Yeah.
And then this year, I kept chugging along because I didn't feel right with my head, and I started having clear liquid coming out of my nose, so only on one side.
Yeah.
And come to find out, it was a cerebral spinal fluid leak, so a CSF leak, which is also not a normal thing. And I got misdiagnosed for sinusitis. And that's how this came about.
Yeah.
Because believe it or not, it was a birth defect that was causing it. So there's a hole in my skull.
Wow.
So craniotomy from 2.5
You
years ago.
had a kind of a growth, not a tumor, but what was it called? That I remember you showing a picture. And sometimes those growths, whatever they're called, you can help us with that. Sometimes it's so much of a growth that it really is protruding out of people's skulls. And yours was small enough, and they caught it soon enough that they was able to do this surgery that we're seeing. Tell us more about that.
So they technically considered it an encephalocele, which I never heard of in my life. Same thing with the trigeminal neuralgia. When I looked up pictures, I'm like, that doesn't look like mine. So my surgeon said it's technically an encephalocele. but not the worst case. It was so small that it's been overlooked in scans, because I've had 2 MRIs and 2 CT scans within the last like year and a half, and it's all been, it hasn't been found.
It has been clean. That's how small it was, right?
Yeah. Yep. And I even asked my surgeon, like, why wasn't this found before?
Right.
Like, why? And he said, well, if you look here, and he pointed at my scan, it was very, very tiny crack.
Mm-hmm.
And that's where I am today. Within a month, I had surgery after seeing him.
Yeah. Yep. I get the quick, after diagnosis, you're in surgery, the next thing you know.
Yeah, and you'll have to kind of forgive the flow. I'd like to go back and understand a little bit of your past story and how you kind of got involved with TikTok and some things, but some things might just come to mind. One thing I wanted to just, yeah, we're going to turn off the fan to kind of help a little bit. One of the things that I want for you and for everybody watching this to know as to why you are a unique person to join this effort is that you help humanity out, and you might argue that maybe we shouldn't need as much help in the chronic pain community in this way, but the way in which you help it is you do provide a physical component to pain that's happening,
Right.
although other things that are happening, and in some cases, with many, they don't have anything like that, right? They don't have a scar, or when Nell had her eye, tumor removal, and her whole eye was puffed up and things. You don't have as much of that for the world to see that things are legitimate. And so in some ways, that's kind of, I think, a unique opportunity to kind of serve to help humanity out in that way, and that it gets their attention that, okay, they're talking about how they've got pain. I obviously can see that stitches across the head is going to be, legitimate. And so part of me feels that that's unfortunate, right? Because that shouldn't have to be that way. But at the same time, it's also kind of being realistic, and that's just part of kind of how humans are, and that they're, if you see someone in a wheelchair or stitches and things like that, then it's like, oh, okay, maybe they've got that credibility. So
and oftentimes it's like, okay, your scar is healed up, so you're healed up,
Oh yeah,
can't see your stitches anymore, can't see your scars so much. So it's really important, and I think such a blessing that we have the technology we do now, because we get to take each other on our journeys, right? So let me show you what this little piece of my slideshow is. And that's what you're doing, and it's amazing.
It is. In fact, I
amazing.
even, sometimes I have a tendency to not be as emotional. I kind of try to toggle between the techie side of me, like I was talking earlier. Full time, I help people get started with their software, but that at home, nobody wants to be married to a tech nerd, right? And so it's a good opportunity to try to be a little bit more emotional and real at home. And I sometimes struggle with that, but when I was watching your story a little bit more, and I seen what you were going through with this recent and your eyes and stuff, I mean, it just breaks your heart. And you are very courageous. There's so many people that would go through that, and they would not have, whether it's the courage, the confidence, the self-esteem,
or the trust in others,
or whatever. Yeah. And so that's what's hard, is that they react into self-isolation. People can't see me like this. What are people going to think of me?
Right.
And Nell has taught me, that, more than anything for me, in how that not only needs to be challenged, but how people can think the opposite when that stuff's put in front of them.
Real quick, somebody's saying they're catching their first live.
Oh,
welcome.
Oh, welcome, you guys. You got Leak Mom 71. sorry if I'm mispronouncing that. But how fun is that, Jessica, to have, you know, one of the things that we have been seeing, and and Nell can, give her impression, but every week we see pockets of people that have their area of influence, and what they're doing and what people are getting exposed to is amazing because it's helping people come together. It's helping increase awareness.
Right.
But as those people come together and then they have cross following and different things, and they start realizing different things that's happening, I don't want to say at higher levels, but people that maybe have the ability to increase the spread of that, right? Like the good things Utah and what they've done and some other things. It's so important. And Nell says this over and over and over and over and over. That's not because we're so special. That is because they know that people like you and people that we are continuing to reach out to, that's who they're representing. That's what they're making the big deal about it. And it's not just Nell and I. It's you guys.
Right. Oh, absolutely. Every time, every week. And today, I'll tell you guys, I was like, Rex, ain't happening. I'm like, please, because you are somebody that I just, yep. Yeah. So that's why I didn't want you to apologize right from the beginning. Mm-hmm. And I asked him to reach out to you, and I'm like, she's someone who I really, really need to do this face-to-face with. Because I have such a connection with our facial pain journey. And even though we have different diagnoses, we know that pain. Rex says, let's just, let's go with it. And so I don't know if a lot of you have seen Rex will sometimes come in and I'm in bed, but you can hear me and I'm talking. So I was like, well, I can do that. But I was like, okay, shower, lay down,
Yeah, the spoony
pull my hair back, lay down,
mm-hmm.
And we're here, and I am so, so entirely grateful. I say this, well, the last couple of lives, and it will continue to be said, there's the word warrior and the word resilience does not do justice to the people that we meet like you. It just doesn't.
Badass.
That is right. That is right.
I mean, there you go. That's what it is. You are badass.
Yeah. So thank you. Thank you so much for just being upright and talking to us. Because you guys, I say upright because that's not easy on some days, or talking. I don't know what part of your face you suffer with the most with the trigeminal neuralgia, but one of my dearest friends and one of the first people that I physically came in contact with that really, before, there was Facebook and Instagram, but not much was being shared. This is probably 10 years ago. And her and I got talking, and she has trigeminal, and she actually added me to the group in Facebook that she was a part of, which I was so grateful for. And for me, they diagnosed me with CRPS, but still, there's so many similarities, right, to what we go through. And I love that group. I love because you guys talk about people taking care of each other. This is where I found complete lack of judgment, complete embracement, embracing each other. And just, I won't use her name, but this is she was one of the first people to really get what I was trying to explain to friends, family, neighbors. You can be a part of my life. It may have to be different than you imagined. But because she lived, we both are living so similar lives, she got it, and she left a letter at my door with a blanket, and she explained that a blanket is like one of the only things, and it was a very soft, fleecy blanket. So she explained that for her, that was the only thing that she could even put near her face. Mm-hmm. And, that was so touching. And so having you here, just...
It's awesome. And these comments, can I just... I got to read some of these comments, you guys. Gracie, bear with me while I kind of put my face up into your... Gracie Colonial. Until I saw Jessica's video 2 days ago, I didn't know there was a chronic pain community on TikTok.
You guys. That's why you're a rock star. That's why.
Brian C. 1972. I've been looking for a chronic pain community.
You guys, then you found your family.
Leak Mom 71. I'm in tears just hearing people who get it and understand.
You are never judged here. I'm fiercely protective. And I know that Jessica is the same way. You are very safe. Don't make me cry, dang it.
And we're so glad that people are they're reaching out. We know that people are reaching out, and it's just so exciting that they're not only finding some of the first people that are out there. Rare Bones. If you guys aren't following Rare Bones, Misty Marvin, all these others, these are individuals that people, have that experience with, and then they see that we're connected, and then they get even more excited. Absolutely. We're not the only community in the world, but boy, it's one that I haven't seen. Welcome.
There's just more that are, this is, chronic pain, and then we'll get Jessica's take on this, but chronic pain is especially difficult because I would even say more so than some mental illnesses, okay? So more than even what's going on in your head, because chronic pain, you can, okay, you're about to get told. But
what is that?
you can, at least I did for years, hit it flawlessly, just about. Mm-hmm. I had moments of, I think I mentioned this last week when we had Liz on. I would have a conversation with someone for hours, and the pain was so bad that I was trying to just swallow and not have, not need to throw up. I know that's gross words, but sorry, guys. That's right. It was so bad that you get nauseous, and I know that you know that. And I would go, our best friend that is here with us and who lives with us, she a couple times had to take me straight from an event or a party or, with just with family, straight from there to the ER. Because my pain had gotten so bad, I knew none of my meds. I know when my pain gets so bad, the medications that I'm prescribed will not work. And so that was one of the hardest things I ever had to do, was just kind of be honest and say, I can't be what everybody needs. But I hope I'm still enough, right? So.
And you felt, and feeling like that is a weakness, right? That moment is a failure, rather than it being maybe even some of the moments that you're standing tallest because you're humble.
Oh, I absolutely felt like a failure because in my life and just my surroundings, doing, serving very physically or in any capacity, mentally, was those good check marks, right? And so whatever anybody could see was being done was what was worthy. And when that started decreasing, so did a lot of people out of my life, because they couldn't see my green check marks anymore.
Yeah.
Even though they were still happening, they couldn't see what anything that I was doing was worth it.
Yeah, genocide saying, what's awful, it's an invisible illness. You look fine, so you should feel fine, right? How many times have we heard that?
And then with me, I adore makeup. We talked to this with Christina, was it? I feel, I'm most often without makeup, but I love it. I would do it more often if I could. So that adds another layer of like, right. If you weren't suffering, you wouldn't do that. Well, that's a connection to me. And so I'm going to do that as often as I can because that's a connection to me that I don't want to lose. So anyway, Jessica, I got ready for you today.
You should feel
like, that doesn't happen often, girl.
Oh,
shut up.
And he's supposed to be on here. He better not be saying goodbye.
He's supposed to be on here.
If that's going to be his only cameo, he better throw out a name.
Tell him he's a rock star too. Right off the bat.
He's a rock star. He's my rock. My rock.
Well,
What's your husband's name, Jessica?
Steve.
Steve?
Yeah.
Tell Steve we say hi.
I will.
Yeah,
I will.
I was so moved by what he was saying and how passionate he was saying it in that car.
Was he on with you today?
No, he did a video. There's a video that was posted.
I've got to watch.
And let me tell you something. There are so many people out there that will give social media such a bad rap, right? They'll talk about the negativity that's on it or whatever. And I am telling you, and I've said this to one of the guests that we've had before. It lets me get to know people so that when we all of a sudden, come on a live like this, I don't feel like that you're a stranger.
Not at all.
You get to know them and their life and what they're about, what their values are, to where if I seen you in the street, it wouldn't be a, oh, well, who are you? And okay, I might have heard you, I've seen you. It's like a, hey, and then, he's like, give you a big hug.
And for me, because I think Rex, especially knowing that there's other significant others that are really sticking through it, they're not going anywhere. And not only that, they're clearly in it no matter how bad it gets. And that doesn't always happen. And this is another thing I've said before. I know of people where they have been left. And I mean left. Their spouse has walked out, their significant other has walked out, and they've left them with no transportation, no medication, no way to get the meds, no money, not very much food. This happens, and this is, as a community, I hope that we all, because Rex and I would love to eventually have this be where we travel and we have people from surrounding areas and we all get together so that we can actually physically see each other.
Yeah.
And, really, really give each other very gentle hugs.
Yeah.
But
even further beyond
but there
COVID,
are people
right?
in true isolation. So that's why, Steve, incredible job.
Yeah. In fact, it's interesting. I know that I haven't really talked directly with him.
Right.
There's one other spouse that we met, and he was on our one of our lives.
Antonio's wife.
Well, her, and then even earlier than that with.
Oh, you're right. Courtney's
husband, and Courtney's husband was the first guy that I have ever met in my whole life.
Yeah.
That was that could relate. I mean, literally, I went years and years and years and years. Felt like that it didn't matter what kind of hardship that people were going through. That was
a massive
They
moment
could never
for us.
really be like, you know what? I know what you're going through. So when I seen him talk, it was immediate connection. So, I mean, give my love to him.
Let's read some of these.
Yeah, let's read some of these.
She might not be seeing some of these.
Yes. Nell, you look... Okay, hold on. Let me back up a little bit. Bear with me here.
And then we're going to give Jessica her dessert.
Yes,
time.
yeah. Then we're going to turn the time over to you and start gabbing here. Gracie Colonial.
Oh, you lost your husband
lost
and
my husband and
I am
friends.
so sorry.
I am so sorry.
I am so sorry. Well, you have us.
Yes.
100%.
Yeah, we are here for you. Living out loud. And by the way, as we read these comments, I want you to know, just for sake of time, as we move on to the next one, it by no means... I mean, we could pause for an hour and talk about the depth of some of these things that you guys are talking about.
And as long as you're doing well, Jessica, there's not a time limit for Rex and I.
Yeah.
So, and I'm trying to convince our friend to like help read the comments.
Yeah.
I'm like, look.
Yeah, is Julie
I'm
in
trying
there?
to listen.
Yeah.
I don't think, no, she's traveling right
now. Brian C, 1972, I'm happy too.
I felt no, go back up again. Okay. I think you missed. So we're trying to do better.
Living out loud. I am so happy you found it. Found the community.
I'm so happy too.
Kansas Sunflower Quitter, makeup is a thing. If the past for me irritates my dry eyes. Oh yeah, sometimes
it can, because you guys, some of you may or may not know, the 3 tumors that I've had have been lacrimal gland tumors, so I may not have my eye in the future, my left eye. But yeah, it's very painful, even a little brush.
Oh, Liz is in here. Liz can help out. In fact, Liz...
Hey, well, she can't physically read them out loud.
Liz says, "Now you look beautiful." Liz is a
thanks, Liz.
Moderator.
I love how he puts people on the spot, too. You're a moderator.
Oh, yeah.
Okay?
She
Listen up. Do your job.
She's joined us.
Like Liz doesn't have a million things to do in her life.
Kansas Sunflower, my husband has been my rock.
Aw, that's good to hear.
Living out loud, absolutely, it's terrible.
Yeah.
Gracie Colonial, lost my husband. He couldn't handle it, but I'm lucky to have my 24-year-old son who takes care of me.
Yeah, those kiddos become very, very tender.
They do.
And they become angels when they live with a parent that has something like this. They end up kind of really growing into the most precious angels. So I'm so glad. I'm so sorry to hear about your husband. So glad that your son is there.
Yeah,
in the ways that you need.
Anybody that stays in your life has got to change their values in some cases and mature.
What's that? I've been dumped because of MS.
Because of MS, Jenny. I'm
not happy. Give me a list of names. I'll take care.
Living out loud, it's hard, especially for men. My husband's often unheard, as fibro is a woman's thing, and I know that. Earlier. Let me just go back just a little bit, because I know that Brian, 1972. Not enough men speak out for fibromyalgia and chronic fatigue and chronic pain. True. And it's true. And I'm so glad that you're with us.
Thank you for scrolling back.
And that you're and that you're being part of this effort. It's so important.
Please. I know us women can get talking but it's there's a few people that I'm trying to convince, whether they're close friends or family, who don't really, it's not normal for them to be on social media. And this was new to me, but it just had to be done. But anyway, I try to convince them and I'll keep working on them, because I don't care if it's one person that all of a sudden has their someone. And you may be a world apart. Let's say you're in Australia. I just lost one of I consider her a dear friend, and she just passed away.
Right?
Yes.
Mm-hmm.
Amy's life. on YouTube if you want to go back and get to know her, even though she's gone, and it was just a couple months ago. And I'm going to try not to cry. But she was one of my people, you know?
Yeah.
And so, yeah, men or anybody that's kind of thinking, I don't know if I want to put myself out there. What Rex and I are learning is there's so much out there that we haven't even heard of. And we're actively kind of looking for you.
I am floored with the lineup. With us being booked through February, I cannot believe the diversity of what people are going through. I had no idea.
There's a reason that they say chronic pain, the chronic pain community, is bigger than the cancer and diabetes community together.
Do you guys believe that?
But we don't talk about it.
It gives me chills.
Because it's so stigmatized and so judged. You're not, this is your time. You have so many people here for you. Speak out. And if you are a little bit nervous, please make sure you reach out. And I know that Jessica would love to hear that you're going on, or we would, to be there to support you. Yeah. Because if it's one person that finally feels like they have someone,
a place of belonging.
You guys, it is so...
Oh, it's such a weight.
We genuinely, and I do not mean this, that there's no exaggeration. We can slow the death rate of someone taking their own life.
Yeah. And
it is critical, and it's years past due.
Yeah, it needs to happen. It's so preventable to just squash stigma and judgment and just flood. You know, it's what God and our Heavenly Father, you know, our faith, it's what He wants for us to do, especially for people that are in pain and vulnerable, is to not be judged and stigmatized. They're the badass warriors that need compassion. And the more that people like you and others, you know, do what we're doing, it helps other people go back into their communities. Right. It starts the conversation.
And be brave in their families. Be brave in their workplace. Be brave, you know. This real quick, this is why, you know, we've mentioned it before. We added the word suffering to it. Because that's where we all connect as humans. We've all suffered, right? So it doesn't matter if you've got a story that is actively causing you suffering, or something that you have gone through and you're proud to say that you lived through it. And please reach out. Please, if you're willing to pass it along, we're willing to be right there with you. Real quick, let us read this.
Yeah, and just on that thought, and then I want to read a little bit more comments. It's helped us talk about it.
Oh my word, yeah.
You guys, it's even been difficult for who you might think, oh, they've got it together, and they're just the ones that are talking, and they're the example. No.
Anybody that's watched me and Rex for long enough, we don't have it together.
No, we are trying to figure this out.
That's the last thing we have.
And so this is a service to us too. You guys are serving and helping us, because, you know, some of these kinds of conversations are really difficult to have. And if that could be, you know what, I got off that live. Yes, not everybody stays for a whole 2 hours, right? Very common for people to kind of come in and come out. And so we encourage people to watch the whole thing. But if that allows for them to be like, hey, I watched just even a little bit of the live, and these are some of the things that they said, and it gets a conversation going with their kids and their spouse and their neighbors. Oh, it's just incredible. So let's go at some of the comments here.
Get caught up a little bit.
Jenny side. It's all good. I didn't need that type of person.
Genocide?
Oh,
or is it genocide?
Yeah, she was responding to Kansas Flower about she's thinking it's a blessing.
Yeah, you're right. Yeah. You don't need that type of person, but you deserve a great person.
Kansas Sunflower. Teresa, I lost most friends, but that's okay. They weren't anyway. Gracie said, you made me cry. Thank you. Got some people. Brian, Uh, I'm gonna say, I don't know if you guys are following Noah Shaky, but he's kind of a youth guy. I think is just incredible youth. But he says, hit me back if you this. And anyway, I see Brian saying, hit me back. Or I mean, I see him saying thank yous. Thank you for
You're very welcome.
The trauma lady. Thank you for a safe place. Genocide. I'm scheduled to do a live with you guys in January.
Yay!
Awesome. We got Antonio in the house as a veteran.
You guys, if you're not following him, one of the funniest.
He's one of our mods, you guys. Antonio Voices. As you guys may or may not know, Nell specifically, when she started all of this, because this is her baby, she wanted it to be chronic pain and suffering, because it includes mental and emotional, suicide. It includes all walks of life. Check out Antonio Voice's story.
Antonio just brings such a light to such a stigmatized thing.
What a classy guy. He knows how to bring humor to a serious
his wife is
topic. Go check him out. We love you. You know we love you, brother. Invisible pain, nerve pain warrior. Invisible pain disabilities are treated like mental patients used to be. Yes. Again,
too often, absolutely.
Got my phone.
Those are some of my peeps.
What's that? Say that again.
So those are some of my peeps coming over there.
Yeah, exactly. That's what I'm saying. I told you I had an incredible following. Some of them are on your end, and some of them are on coming over here.
Yeah, I love when you guys. There's two lives. You hop back and forth. It's awesome.
We've got
you hoppers.
We got Leak Mom. You have no idea how bad you needed this. This week has been unbearable, both mentally and physically.
I am so sorry, but so happy you're here.
Yeah, really.
I think more doctors should be aware.
Nerve pain warrior of the rare diseases, so that they can treat them easier.
Let me really quickly.
What's up, Ryan? I see you, brother.
Who just?
That's Nerve Pain Warrior. She's talking about how doctors and what they're.
So yeah, I wanted to say this really quickly. There's a new documentary out there, you guys, I believe it's called Diagnosis, and it's amazing. So. Real quick, this doctor, she was kind of advisor. Have any of you seen, why did that just go out of my head? I hate when that happens. Hold on.
Diagnosis.
No, I know.
The one that we just watched?
No, the doctor that she advised. Okay, House. Have any of you seen House? I love that show. It's amazing. So she was an advisor to the show House, and she's a doctor, I believe, in New York, and she started a documentary that's called Diagnosis, where she actually uses just the normal everyday public to help doctors get the right diagnosis. It is beautiful.
It's incredible. You guys haven't seen it.
While we're not saying so you guys, if you find someone that that they don't quite have that diagnosis and it sounds similar to what, please reach out to them. Of course, we're not given the diagnosis ourselves, but they might be able to go then to their doctor and say, hey, I've had some suggestions. Can you run a certain blood test? Can you maybe get a scan? Because people are helping people and helping the medical community. Yeah. And it's such a beautiful partnership, because I think a lot of times we get really angry with our doctors when they don't know, and we forget they're human as well, and that they may not be,
Well, and I think that we live in a time where there's so much advancement,
right,
that we almost kind of need to check our mindset and expectations, and that it's kind of like, I could never possibly, if I need to move into places of specialty that has that far advancement, I could never meet the cap of where they're at with society. They're still, I mean, even though it's progressed over time, there's always been people. What?
Hold
there's always been people in every generation that has been part of the pioneering process to help
Yes.
further things.
I'll never forget when one doctor said,
And so
she finally said, you know, you can look on Google. And I was shocked.
Yeah.
I was shocked. But then, you know, again, just realizing that she had done her best, several visits, and I love her. She means a lot to me, and I was sad to see her move on to another position, but there's a lot of complicated illnesses out there. And what we're realizing is that now that we have this technology that Jessica is using so beautifully, we're helping each other find diagnoses faster. We're helping each other get through another day. We're helping each other. You know, I truly feel it's beyond friendships to me, your family. And
yeah,
that's why, you know, the a fierceness is the only way I can describe it of the protection of what we have.
Yeah, and it's okay that it's a maturing process, and that doesn't mean that we all are, you know, immature. I'm not saying that, but it's normal to, when this is going on, to want to kind of be in that place where you're like, hey, look, I live in a world, people could do a lot of things. Doctors should have answers, solutions, cures, whatever.
Right.
Help me, I want this to be fixed. And that's kind of understandable. Nobody wants to be like, you know what? Let me sign up to be the poster child of how do I figure something else and suffer in the process. You know what I mean? So it's hard to kind of have that attitude, but at the same time, it's kind of an opportunity for us to help even them. And I know that that's a kind of a difficult way to think of it, especially if you've kind of been rubbed the wrong way with experts. And we have had some of that experience. We've had good doctors and bad. But I don't know, think on that in terms of how can we work with them?
I would encourage all of you to go see the documentary Diagnosis. I believe we found it on Netflix. And it was came up as a newer one. You'll really enjoy it. They've had situations where people were kind of in dire straits, didn't have a lot of time, you know, before they had to make a decision, a life-altering decision.
Yeah, I don't want to give away this part of the story, but a major life
the community
decision.
Whether it's chronic pain or any other disease or condition, really have stepped up and saved a lot of extra pain, maybe money, but certainly lives. It's beautiful. Yeah. But anyway, I think we just have a couple more
comments, and then you guys.
Whoa!
I know the phone is a little wobbly. There we go. That's a little solid.
As a member of the healthcare community for work, I tell my patients to advocate for. Yes. And that is so true. You know your body better than anyone, and you guys know what you're going through. And don't ever downplay what you're feeling.
And I love that, you know, not only the comments, and it allows us opportunity to engage, but I see you guys engaging with each other.
Yeah, we love that.
That's what we want, right? You know, we don't want any of you to feel like that we're not, you know, a comment that you've been heard. But sometimes, you know, it's an opportunity for you guys to have chatter among yourself too, especially as we get into turning the time over a little bit, you know. What's to you, name? Jessica.
You guys, I hate that the names are grayed out more.
Which one?
The middle.
Shar Josie.
Okay.
I've been blessed to have an amazing doctors. I've had 2 brain surgeries in a year. Wow.
My word,
and
lady.
It makes a difference.
You are working. I think you went down a little far. There we go.
We are the biggest advocates.
They must.
I asked one doctor, what do you expect me to do? He said they expect me to die. Are you kidding, Brian?
That did not happen.
Are you kidding?
You guys.
Oh my gosh, dude. That is not okay. Are you kidding?
I can't.
You know what?
These are devastating.
Alexandra, the artist, go check out the artist that we just had, the body paint artist.
2 weeks ago.
She said somebody in Canada when she had her illness that they were like, go home, basically go home and die.
Yep. So because her and her mom had something, they kind of put their beds together and...
Goodness grief, you know?
Yeah.
So I'm sorry.
So what was this one? I'm thankful to have always believed my daughters. Yeah.
I've never felt
that
crazy
is
for feeling different.
Such a blessing. You are so right. Yes, we are.
Take
Good for you.
Yeah.
I struggle with that. Yep, it's easy. It's easy to believe what others think and say. It doesn't matter who.
Especially if they're...
It's easy to take on those beliefs and not take yourself serious. So
I'll tell you one other thing, and I don't know if this has any impact on what you had said earlier, Jessica, to where you're like not giving yourself the kind of credit that you deserve. But when you have somebody in authority that treats you in a way that is less than deserving, or even you are traumatized because of it,
right?
It I don't know why, but it's just traumatizing. You almost feel like that it's because, like, if they've said it, that it must be true. It's kind of like a child getting told by abusive parents that they're nothing and this or whatever. I mean, part of the trauma is that for a time you're believing it because you're like, well, it must be true. You're my mom or you're my dad, kind of a thing. So if you have experienced any trauma by any authority figure,
I've been told she straight out said, you're an addict. That hurt because I had walked my own, pardon my French, but I walked my own ass in to a detox hospital to be detoxed from meds doctors put me on. And
not because she was addicted, but because they messed up with a combination and she needed to clean the slate.
And that wasn't, fun to be locked behind 4 doors and to be them to take all your clothes and
rummage through them and stuff.
Take wires out and ties off because of suicide risks, and you're watched every minute. In the long run, it was one of the biggest blessings of my life because of the people that I met, but it was one of the hardest times in my life too. And every single medication I was on was prescribed because doctors were just throwing them at me because they just didn't know what else to do. But then it was right after I came out, and a doctor, it was the first visit, and he, which is just so ironic just because of the timing, said, I think you're an addict and I won't give you anything.
Feel like that?
So
blood boil, right, guys? I mean, I'm just hearing the amen behind that.
Yeah. So anyway, I've told hospital. Oh, you guys. Yeah. Our hearts go out to you.
I'm so sorry, guys.
Jessica. I would really like to know. So, besides this, and I've already forgotten the name, but besides this condition of spinal fluid, is that what it was that's leaking, or was leaking?
Yeah.
Did they put a shunt in for that? Is that what they do, or no?
No. For this surgery, what they did is they had to fill my skull where the hole was with bone cement. They had to file down where the birth defect was, because over time, so to clarify, when you're born, your skull is like in 6 different pieces, but it's soft. So I think when I was born, it didn't form correctly.
Okay.
So it's kind of like 2 ridges. And over time, the cliff ridge, I'll just call it, protruded into the CSF layer, and then was starting to go past the first membrane.
Oh my! And
there's only a couple membranes before your brain.
Yeah.
So they had to fix the hole, file down the 2 pieces of bone, because it was also impacting my sinus cavities. So all my sinus cavities were full. and they had to drain my sinus cavities, and that was that surgery.
Would you get a lot of sinus infections? Just curious.
No.
Okay. Okay. I did.
Thankfully.
So, yeah. But go on. Yeah, that's interesting. So you're saying they kind of did a cement?
Yeah, they called it bone cement.
Okay.
Wow. I don't know.
Do they think this is going to be the surgery, or do you need more? Possibly for that.
To fix the CSF layer, this should be it. Hopefully.
I hope so.
Yeah, I gotta knock on wood with that.
We'll be praying that it is, absolutely.
Yeah, I am too. Because a CSF leak is not a normal thing. It's very rare. Not many people know about it.
Yeah.
I did get misdiagnosed sinusitis at first, and I'm like, no, this doesn't feel like that.
Good for you.
I had a lot of these awful symptoms. It was like a sinus infection, but like times 10 just for the headaches.
Yeah.
Twice I almost called 911, which my husband doesn't know, that I felt like
I love it.
This eyeball. Yeah, this eyeball was gonna pop out because of the pressure. And I was scared.
Oh my Lord.
Her eye was coming out slowly.
Yeah. I was so terrified because I could feel the pressure. And he finally woke up one day. I don't know why he chose a certain time, but he's like, hey, your eye's like coming out and down. But not just that, my entire skull was coming. It's amazing the pressure that can happen even with your bone, right? My entire skull right here was changing shape. But yeah, my eye was starting to protrude. So I get you, girl. Scary as all get out. It's insane.
It was. By the way, they say that they love you.
Oh, I love you too.
Yeah, man.
He came back up. Tell him.
Oh yeah, I was very impressed with that video and
in the car,
and just really connect with you with what you're trying to do. So love and respect, bro.
Absolutely.
He calls it actually the light at the end of the tunnel video, because when he ends his rant, it's literally the light at the end of the tunnel. We're in Boston, so it worked out.
Yeah.
Well, I can't tell you how many people feel the exact same way that he was expressing it. And he expressed it in a way that, fine, there's always going to be a part of kind of frustration and anger, but he does it in a way that's not just lashing out negative. He does it in a way that just has strength, that has, you know what? We don't know why we've been put in these situations, but we can choose how to respond.
Says a lot about the man he is.
Yeah. And I have a lot of respect for him. He's a good example.
We need to do something for our supporters, you guys.
Yeah.
That would be fun. For the people that support us, right? So besides the leak, what?
He just said that we need more supporters, and that he's happy to do it.
Yeah.
Yeah, we do.
Yeah.
Yes. Let's put our heads together and figure that out, because there's not enough that I personally can do to bring the stress down for Rex. I'm always in support of and happy to see him actually go out. I'll let him know I'm fine. Even if there's pain, there's pain. There's pain when he's here. There's not much he can do. So often I'll be like, go out, before COVID, I guess. Yeah, go out to the movies, or go out with,
or running,
one of my brothers, or out with your friends.
Or if I'm working out or running, or she's just really encouraging.
But it's a whole different thing when you have a support group for people, for our supporters, right?
Yeah, exactly.
And honestly, maybe more of them would stay if they felt they knew where to go to get support.
Yeah, because
we've got it. That's a whole nother branch of this that has to be addressed. But well done.
Right.
Yeah.
Well done to him.
Yeah, absolutely.
Well Want a high five? Okay.
She's talking about that. Jessica, before you had, we've talked a little bit about this most recent surgery because it's just been most recent. Before
and
then,
quite a major one. My word.
Absolutely. The facial nerve pain, I know, has been a big part of your life. Take us back a little bit about what your story has kind of been and when you started developing a condition. How long have you been going through that, and kind of what led you and drew you to kind of join TikTok and start reaching out to people? Talk to us a little bit about that.
Okay. I have a whole timeline. That's how much I've
prepared.
I bet. I bet you guys, that's so awesome.
Girl. Whatever you got to do your thing.
I love it.
One thing that I do want to start off with is I want to make sure that you guys are not alone. Nobody is alone here, especially with the facial pain. I am part of the Facial Pain Association to try and help others with any facial pain, so I'm a peer mentor. But this is what I got in the mail today. I think it's actually a good message for people. You are not alone.
Who's it from?
You're not alone.
Right there.
So it's a facial pain association?
Yes.
That's amazing.
Yeah. But to start off with the nerve issue is, it was February 2018. My family and I were on a cruise. And before we went on the cruise, I noticed that I was having an ear infection in this one.
Yep.
And so I went to the doctor. They said, yes, you have an ear infection. Here's an antibiotic. It won't go away.
Okay.
Here's another antibiotic that was stronger. It still won't go away. She did prescribe me Tramadol, which is classified on the opiate list, but it's on the lowest amount of the opiate list. So I did try that. It didn't do anything.
Right.
So then she said, well, if this doesn't work, you need to go see an ENT. I had to go do that. My hearing was fine. My nose was fine. My throat was fine. He said, well, you need to go see an oral surgeon because we think it's a jaw problem, probably like TMJ.
Yeah.
I went to my dentist first because I've been seeing him for over 20 years. He knows my jaw in and out. So if I'm going to trust somebody, I'm going to go see him first.
Yeah.
He took a full x-ray of my mouth, and he said there might be a little bit something on that jawbone, but you definitely need to see an oral surgeon. I'm like, all right, here we go. Let's keep going. So I go see an oral surgeon. He said, it's a facial muscle spasm, which I forget what it's called. It's like a hemifacial something like that spasm.
Wow.
He wrote a prescription for 4 weeks of PT, and then a prescription, like a muscle relaxer called Soma. SOMA. Did the 4 weeks of PT. The prescription didn't even touch anything. I went back to him.
Is that what the PT entailed?
No, that's why you're here.
That torture?
Where's the pants? We know who wears the pants, everybody. Pant check.
Hey,
sorry.
You need to
got one leg and I got the other. It's shared.
I like it. Can dig it.
I love the realness.
I can dig it.
So, yeah, I went back. He said, okay, we're going to do another 4 weeks of PT. I'm going to write you another script for Soma. I'm like, all right. So I do that. That didn't work. So then he said, okay, let's try Botox. Botox was out of pocket. My insurance didn't cover it. It was $300, so I had to fork up for that. Tried that. Never again. Maybe when I'm older and I got lines or something, but no, not for this pain.
Did it backfire?
Did that not work for you? The injections and things?
Oh no, it was hell.
It
Really?
can backfire.
It's worked for now, but it's interesting that it doesn't work for everybody. It just goes to show, right?
Yeah, I think it works for me for about 30% of my pain, but she does everywhere. Straight in the back of my head, down my neck, my shoulders, face. Yeah, but yeah, it's $1,000. We would have to pay $1,000 out of pocket because we just switched insurances. Because each time it's $5,000, you guys. So, yeah,
Right.
fun.
It's absurd. But I went back to him because I'm like, the pain's still there, and it got worse. And mind you, I'm still like in a lot of pain. It like magnified.
Yep.
And for him to even check my mouth, he had to go one finger on the outside, one on the inside, and he's pushing up on that nerve the whole time.
Oh.
I'm in tears.
Mm-hmm.
My husband's next to me. He's like, "What is going on? What are you doing to my wife?"
Yeah.
And I'm in agony. So he's like, "Okay, we can try another Botox." No, we're not. We're not.
Yeah. Nope, didn't work.
No, so I had to fight the insurance to get an MRI of my jaw because that's what he wanted.
You had to fight him to get an MRI?
The insurance company, yeah.
Wow, they can be.
That's
we all got stories, I'm sure, about insurance, right?
Yeah. And you need a set?
I will. I just want to make sure.
Woo!
Welcome, you guys, for those coming in.
So brain fog going on.
Insurance, they wouldn't cover. They
went to your insurance and they were like, nah, for your MRI,
and they were messing with your mouth.
Yeah,
and the doctor was being mean.
Pretty much covering
pinching you and stuff.
The MRI came back, showed nothing. Okay, so then my PCP told me to go to a neurologist because now it might be a nerve issue.
Yeah.
I went to the neurologist. She had me do an MRI. MRI came back normal. It was read by her, the radiologist, and another doctor, because it's like you get a radiologist and then a second doctor to read the MRI, and then your neurologist. Came back, she said everything looks fine. Okay.
Yeah, that's maddening.
Yeah, and then at that point I went to pain management.
Mm-hmm.
Pain management said, and I'll never forget this because it was on Martin Luther King Jr. Day of 2019. Okay. There are dates that you just don't forget.
You're right. Like You're right.
And he said, we're going to try and do a ganglion nerve block. And this is going to be, I just saw the hand go over the heart. Oh, God.
You did that too. What the hell, lady?
What'd I do? Breathe.
No, I will tell you right now, the worst backfire and the second to the worst pain I've ever been in.
That was through the net, right?
It's right there-ish.
Yeah.
And he said he was going to hit it extra hard because he could see I was swollen, I was fevered with the CRPS, I was, my brain just keeps saying there's injuries, so it reacts that way.
Right.
And he said, he told me right before, I'm going to hit it extra hard. And I'm not ever afraid of needles, pain. You kind of, after so long, just, there's not much that phases you. But when the anesthesia wore off, that was about 8 hours of
like her teeth and the
it
whole
backfired.
Side of her face.
Every nerve that there is in your face and every tooth, and it was straight down the middle. And they were panicking and trying to get medication made because it had to be, that ketamine cream. I'm sure you've heard of ketamine that puts people to sleep for surgeries. They're trying to get the cream made for it, and because the pain was just, that was
crazy.
That was,
and you had, even though it was in a different place on the they didn't go through the neck. They said you're there. You were saying?
So when you so they did it, and then what?
So what they told me is going to be either it was going to be like a two reason, like man, I'm having a brain fart so bad. They told me it was going to be a form of treatment as well as the diagnosis.
Oh
yeah. If I don't know if this is what they meant, but part of what they do is that there's some treatment benefit, but that it also is helping them to discover things in the diagnosis process.
Sometimes process of elimination.
Yeah,
I guess.
Yeah, kind of like, hey, if your body responds to that, then that tells us it's not this.
So how did you respond to that?
Not well at all. The anesthesia, once that wore off, my pain was by my ear and it moved to the back of my head. And I was in so much agony that I tried reaching out to my primary care again, and she's like, well, I don't prescribe opiates, and you're too young and it has addictive properties. That's what I was told.
Never asked for it.
And you're like, give me a better option.
Right, just something. And then I even brought up to the neurologist before this little injection that I had all the information of trigeminal neuralgia.
Right.
Had it ready to discuss, just have it be an option. And she said, I don't think you have that.
Just really quick.
Real quick.
Did she give you a reason why she thought that? Or was it just...
She didn't know what it was.
Yeah, that's unfortunate.
Yeah, and see, there we go again.
Yeah.
Yep. I fired a lot of doctors.
No, what got me about that was when she literally turned around to a book and dusted it off to see, for options. When you tried to describe, she was like, wow, really? That's really?
That was my primary care.
Oh, yeah?
Yeah, I know.
I had to bring up medications or other treatments to my primary care because at that time she was the only one that would listen to me a little bit. And she's like, oh, I have to dust off my old book and see.
Yeah.
And then I'm like, well, how about the pain get worse? It was Trigeminal, that's what it was. So it's not like it's an opiate or even a nerve pain pill, because I know they have gabapentin and Lyrica that's technically on the controlled substance list. It's Trigeminal. And she's like, well, I need to check my book real quick.
Yeah.
Okay.
I get you in so many ways. It's unreal.
I was forced to do a lot of my own research. Become my own doctor. So at the time, I was really lost. I was getting angry, but I was losing myself at that time too. So Boston's like the place to be around here. I was going local at first, and I said, you know what? I'm bringing my scan. I'm going to Boston. And actually, that's when I found the Facial Pain Association's website. And they have a lot of information on there. And there's a section called Find a Doctor. So I looked in Massachusetts, and there's a neurologist and there's a neurosurgeon.
Good.
So I looked up the neurosurgeon, which his name is Dr. Wu. He did all my surgeries here. And because I always research doctors before I go. I always research medications, all that stuff, because it's
Yep.
going in my body.
Yeah, because you cannot afford, you guys, honestly, and most of you know in here, doing that research may save you a lot of time, a lot of money that we just don't have anymore. You know, we're stripped of time and money and patience, and the pain usually is growing, getting worse because it's not being attended to. So I'm so glad you found that website. Did it help?
At first, not really, just because I was so mentally exhausted with everything. I didn't know where to go, who to turn to.
Right.
I started losing faith, really, in the medical system. And I know they're human, they have their jobs too, but it was just that humanity level of nobody was listening.
Yeah.
Yeah.
I'm not being heard.
Right. And I'm not crazy. I mean, if you look me up in the system, even for the emergency rooms before this, I was non-existent, really.
Yeah.
And they're treating me like I was just a complete red flag. And I'm not one to lie or BS anything. I think everyone knows that by now. And for me to go to a doctor, I'm waving the SOS flag.
Exactly.
Yeah.
Yep.
So I went into Boston to finish that. I went to Boston, and it was February 20th, 2019. So I didn't wait too long after that nerve block.
Yeah.
His name is Dr. Wu. He has over 35 years experience for a neurosurgeon. And when I got into the appointment, they do the whole neurological test. So I did that. Everything seemed fine with that. He came in the room, popped in my skin, and within 30 seconds, he goes, "There's your problem right there." And it was a compression in my brain.
That's
so right
insane.
then I was diagnosed. Yeah.
That's why you remember that date. There's another date.
Yep. May 6th of that year is when I had my MVD surgery.
Oh, he did not waste time.
What's the surgery called, and was that in relation to the first condition, the nerve, or was it this?
No, her trigeminal. Yeah. No.
Yeah, it's called multivascular decompression surgery.
My word.
My word.
Yeah.
That's why MVD. That one is actually back here. They go back. And the typical surgery is you have your trigeminal nerve, and typically there's something rubbing against it, like an artery or vein.
Yeah.
And for me, what was it? An artery?
Yeah.
An artery. Okay. So when he opened, okay, I got the word. See the pants?
It doesn't take much, right? With those nerves, oh my word, the teeniest little anything.
Yeah,
so yeah.
Even with the recovery here, I'm still having little flares here and there.
Yeah.
And in the hospital, they weren't really listening to a point, so I was getting pretty upset.
Yeah. Understand.
I make it hard now.
Jeez.
But yeah, for me, it was the compression of my main trigeminal nerve, and they go off in branches of V1, V2, and V3. So, 1, 2, 3. But they, like you say, they go off into little tiny nerves too. And for me, it was shooting right across my cheek. So every time brushing my teeth, that was the main area. Thankfully, it didn't go down to my teeth, because I've already had teeth problems enough. But when he was in the surgery, it was about 5-hour surgery, he saw that it was the trigeminal nerve, and there was a bunch of blood arteries, so he had to actually cauterize.
Okay.
Cut, cauterize, and move it.
Yep.
Had about a month and a half of pain-free, and then it came back with a vengeance.
No.
So I had to go back and figure out what was going on. One of the team members said that once it was cut and cauterized, they consider it, it's more or less going to be an automatic fail of a surgery. So then I got diagnosed with the atypical trigeminal neuralgia. So that's a lot harder to treat.
Yeah.
And I was fighting pain in the ER probably about once a month because of flares.
That's insane.
Because nobody would, I go back to pain management and stuff, and nobody would help me.
Yeah.
So my only option was to go to the emergency room, and the only thing that would help me is Toradol, a bag of fluids, and Dilaudid.
Yeah.
But of course, as soon as I say Dilaudid,
cocktail.
They had to take several visits, several hours to find. They mix 4 or 5 medications that will finally hit it.
Only hit it for her.
And I was like, okay, now that we found it, that's in your system, right? Like you have it all written down, how much, and they do. But I get that. But it's also frustrating going in there because I don't want to say they don't like the chronic pain. Like, oh, you're in here for your head pain. Yeah, it's not life threatening, but it kind of is.
Well, they actually, one of the last times I was in there, they flat out told me we don't treat chronic pain.
What are you supposed to do?
Yeah, where are you?
My husband had the great idea of saying you have an acute flare from a chronic pain condition.
Good. Because that word acute does get their attention.
Almost like you want to play this game? Well,
yeah. They definitely listen to him more than they do me.
Yeah. I get very defensive. I'm fiercely defensive.
Where when I go in, I'm in so much pain, it's hard to even listen to what they're saying or answer back. And I get really agitated because they have so much on me on their file, and it's the same questions. And I just want to say, sit at your computer for a second.
Exactly.
Like, you know me. Yeah.
Right.
So.
But it's because since it's an ER, it's kind of like get in, get out type thing.
Yeah, absolutely.
Yeah, that's another topic altogether in terms of the medical industry right now with what they view themselves as focusing on, as if you're not about to die, then we need to try to keep you from dying, and then out you go, and it's someone else's problem kind of thing.
But honestly, anybody that knows pain to this degree has one time or another or several times felt the very real, my body can die from pain. Like, I have known, because my heart was working so hard, my everything was and it's hard to breathe, and it's hard. And even in the hospital, they'll be like coming in every 15 minutes going, breathe, Yeah. And I'm like, I can't, to take a deep breath, that hurts. It hurts. Right. It's amazing how the littlest things. So yeah, it is. It's very...
It turns into a fear of you're not in control of your body.
Yeah, it's crazy.
And that's what scares me, and I have to try and tell myself you're not in control to a point.
Yeah.
But I guess that's where it's the education of trying to find what your triggers are, what works, what doesn't work, and it takes time.
Yep.
It does take time. I mean, I've been battling this for 3 years now. Where many people, when he was doing the rant, that's when we found somebody who just jumped in the live that's 23. And
yeah, that's what I heard. And she was like, I don't know what to do this. I'm just new to this.
Wow.
And she was feeling like in despair or something.
Was this your live today?
No, it was a post that they did,
Okay.
and he was
Actually, the
responding to
staple
like, "Don't you give up? You know, you're."
Oh, good.
Yeah.
That was actually the staple removal. I started from as
Okay.
soon as I got the staples out all the way.
You're on your
to,
way to the staple removal, I think, right?
No, on the way home.
Oh,
Okay.
I was on the way home.
Yeah.
Okay.
Because I even
Sorry,
got
I had
sick
staples.
on the way home, and I said, "Oh, I should stop the live." And I said, "Nope, because this is real life. This is what happens. This
Yeah.
is my
Good for
pain."
you.
So it's just, I'm putting myself out there.
Yeah, thank
It's
you
hard.
so much.
People will eat it up. I tell you, you know,
Well, they clearly are, and you're clearly loved. my word.
authenticity right now is
Both of
gold.
you. Both of you.
Real authenticity and bringing somebody behind the scenes with you, they'll eat it up.
Oh, so
So
yeah, someone's saying as a nurse that works in a hospital in Florida, they say that we don't treat chronic pain. And to a point, I can.
No, they're saying it's ridiculous. They're saying what she said, and
Right.
and they're saying, yeah, that's ridiculous.
Right.
Oh, okay.
But to a point, I have a lot of compassion. You know, even with the, you know, you're an addict. That doctor was cut out of my life very quickly because, you know, he just, you could tell he was young and kind of, we even talked to the supervisor that supervised that office of doctors, and she said he's new, he was very young, and I said, well, he needs to learn some bedside manners really quick.
yes.
But I still have compassion with, you know, what they do have to deal with, and even with the very real, it's not a problem, it's far beyond that, with people being addicted to meds and dying. And I don't want to judge them because they're a part of that suffering that we want to understand, right?
Yeah, in a way, they're part of the community too. I mean, it just, you know, it would be wrong for us to kind of just exclude them, to be like, oh, well, we're the good pain people. We're trying to follow the rules.
No, because
and
their pain is just different.
Yeah, they've got pain and
are they making the best decisions? No. Is it making it hard for us? Very much.
Mm-hmm.
So there's some, I don't know. I don't know what the answer is or what might happen in the future, but I do have compassion for anyone suffering or anyone, like our youngest daughter plans on being a paramedic. And so she'll be faced with some of those hard decisions and watching people really suffering and not being able to help as much as she would if it was just her choices. You know what I mean? So,
yeah.
But with a doctor that just does not want to listen or doesn't want to take the time, that's inexcusable. It's just not. It's not okay in any world.
Yeah, shout out to Curly Dog 829. You guys follow her. She was our first live follower, and we're going to be interviewing her later. But she has hung in with us from the very beginning. Before, I think we were even with Good Things Utah before we even yeah. So she's a huge advocate.
She says, as a nurse and a patient, I know firsthand. So, yep.
Yeah,
thank you for sharing
that. Amazing. So you guys go follow her, Curly Dog 829.
Thank you, sweet
We'll be glad
lady.
you did.
Okay, Jessica. Yeah, continue.
So what really upset me was I'm sure you would relate. At home, I would purposely take pictures for proof of like my blood pressure, of when I'm in pain versus when I'm not in pain.
Yeah.
So I would take it before I go to the ER, and then I would take it when I get home from the ER.
Good
and I would
for
even
you.
I would even take a picture of my vitals in the ER to show proof to doctors. I would send it to them because over in Mass we have a thing called the Gateway, Patient Gateway, where we can directly message our doctors.
Yep.
And I would show the pictures and there'd be no response. Nothing.
That's crazy.
And I'm like, thanks a lot. And then I even did it to send it to my neurologist. There'd be nothing. So it was like me as an SOS to them, and there'd be nothing in return.
Because they might have to say, I was wrong sometimes, or thank you for helping teach me, or, you know, I think a lot of that's hard to swallow sometimes as a doctor. But I applaud you for doing that.
Yeah, for sure.
Thank you.
That really, I've taken pictures of my, like my body swelling and well, and even doctors, a couple of them it's stopped them so much in their tracks. They're like, they've asked right there and then, can I take a picture?
Or even your temperature, even feeling it.
Yeah. So when the CRPS for me is a really bad flare up, when I walk by someone, they can feel the heat. I don't have to touch them.
That's why you have to forgive. You could probably hear to some degree the fans going.
I always have at least 3 fans.
And that might help. You know, we got to have some fans going, so hopefully that's not hurting the audio too much. But we got to keep this girl cool.
Yeah, I do not wear a coat in the winter. I do not. But so I actually, part of what makes me flare up even worse is the temperatures that we're having in the summer. Yeah. And, you know, the AC bill goes, because what am I going to do? Yeah, I've got not one, but 2 icy drinks.
We've got an ice maker on the top level.
You guys, if you're someone that needs, I've got to put a plug in for this product.
It is incredible.
So we have 3 levels to our home, and quite frankly, so we have Colgan, and it kind of refrigerates it. You know, you get the hot cold water, but not enough. So, but we have things to make it easier for me on hard days, so I don't have to go up and down.
Yeah, I've made like a kitchenette area.
Yeah,
in our top.
Yeah, it looks like a break room, but there's an amazing. I don't know if any of you haven't heard of. I think the one I have is by the company Igloo that makes coolers, but it is just a small ice maker, and you put the water in it. It
is a good quality, solid, affordable product. If you need ice,
out the ice, and it's such a little thing. It cranks out the ice.
We're not sponsored, no affiliation, but go get one.
So I know that a lot of people ice for your pain might help. Mm-hmm. But these little Igloo, look it up. I got the really cute mint green one, but it cranks out the ice. I'm so shocked at how every time I go in there, it's full. Yeah,
it's really helpful.
And it doesn't take up much space, and it's portable. It can go anywhere with you. It comes with you can plug it into your car. Mm-hmm. So, if you need it while you're traveling, it's just so convenient. So remember that, guys, if you need ice. If you need extra ice and don't want to travel for it. But yeah, I had to do that quick plug. You said it out again.
So after you had... Oh, go ahead.
So someone's asking a question. Jessica, I'll let you answer. Someone said, he said a doctor can't treat a picture. So what am I supposed to do?
A doctor can't treat...
I need more info.
A doctor can't treat a picture. Oh, well, I think that the idea is just...
Igloo Ice Maker got it.
Let
me go back. If
you bring pictures because you're feeling like the medical experts that you're working with you're having a hard time convincing them that something is going on, I think that's where we're coming from. It's not just, try to expect for them to treat something here. Let me show you, and it's not here.
She's showing a notebook, which I assume is It's just
a way to kind of help.
But still, I'm surprised that a doctor would say that, because like Jessica's explaining, it's not always going to happen in front of a doctor or in the hospital. You know, so.
Well, and if a doctor,
I would have a little pushback if that were me. I'd be like, what? You know.
Yeah.
Do you want to come spend 48 hours with me at my home? Is that your suggestion?
Yeah, but if that's coming from a doctor,
all I have.
Then you need to.
Yeah, I don't like that response at all.
There's enough medical experts out there that are getting enough right. Don't think that you have to put up with stuff like that. If someone is giving you an attitude of like, well, great, you're showing me a picture. Well, I can't treat that. I don't have it now. I mean, what about saying this is good information? Can we get a copy of that and put that on your file? Because,
absolutely.
You know, helping you to feel validated that what you're doing in terms of your research and your information.
Journal everything you can.
Yeah, not coming across with an absent bedside manner and making you feel like that you're crazy because you're trying to be helpful.
Right.
You know, so I don't know what all the details were or if we got that right, but it sounds to me like time to maybe, you know, get second opinions maybe or something if someone's treating you that way.
Yeah, that's not okay.
Yeah, it's not.
I mean, for doctors who didn't validate my pain, I just said, see ya. I don't want to be around you. I'll find somebody else.
Yeah.
Yeah, good for you.
Well, I have to. If you're not going to listen to me, if you're not even going to have a conversation with me, then I can't spend my whatever spoons I got left or whatever energy.
You don't have that privilege anymore. It literally is, that's been taken away. We don't have, like I said, our patience, our time, our money, our energy levels, we're exhausted beyond. So to find a doctor that is just willing to listen and just check their ego at the door
to validate
is amazing.
That's a big deal right there.
And there's a lot of them out there.
It's almost
Don't
half
give
the
up.
battle.
Keep looking.
Half the battle, someone that will genuinely listen, care, and validate what you're going through. Right there, boom. That's like half of it. Okay, we can work through the details.
Even more than half, I think. Because then those are going to be the ones that are not going to stop.
Yeah, rather than treating you like a number. Okay, I'm over you. Number 2, number 3, number 1,000th.
Right.
You know. So
it took me 4 neurologists to find a good one.
Yeah.
And then 2 neurosurgeons. So it's hard, but when you find that one, it makes a difference, because the one that I found was the one that fought for the CSF test for me.
And that's massive.
Yeah, immediately, like as soon as I tested positive, he's like, can you come back to the hospital? We need to do an MRI and a CT scan like right now.
So help me fill in the gap that I've got between the first condition and surgery that you had and then the development of this. I mean, are they connected? What's the timeline between the two?
Oh, Pearly Dog, that's good to hear. Really good to hear.
Mm-hmm.
So last year, this issue, this whole issue has nothing to do with this.
Oh, okay.
Right, 2 different things.
Just separate identity. I'm a rarity.
Our similarities are too much.
And that started. This started how long ago?
Well, geez, do they even know?
The symptoms for that, I didn't even know about the birth defect until the CSF symptoms really started coming full force, and that was probably earlier this year.
So earlier this year, you started experiencing what? Just pressure around your eye, and you felt. What was the onset?
You have a lot of nausea, a lot of brain fog, but I call it brain frog.
I noticed that. I was like, did I hear that right?
It can be brain frog. We're good.
I want to put it on a t-shirt.
Yeah,
that's so
merch.
Awesome.
Merch.
I did.
Get your merch.
Yeah, my merch. My merch. Mood swings really, really bad.
Really?
Really bad. I was not pleasant to be around as much.
Mm.
It was just quick, snappy.
Yeah.
You never know when I was gonna snap.
Yeah.
The headaches alone, it was just these awful pressure headaches. And it got worse with temperature, it got worse with bending down. So whenever I bent over, my nose would just start pouring out with that liquid.
Gosh.
A lot of days I would have to have tissue in my nose, which I do have some videos of me doing that, to make sure it doesn't all come out. And with further research that my husband did, because we were concerned that the CSF leak was going to have all the CSF come out.
Yeah.
And he said that every 4 to 5 hours your body produces the full amount. So my body was constantly trying
What
to
is it again that was coming out?
cerebral spinal fluid.
Are you
Yeah. I'm not shiznitting you.
Not your average runny nose.
I don't know how I would
Not
lose my
average.
mind.
Well, that's why your husband was like, what do we? But that's so it actually reproduces.
What's up, bro?
Hey, it's good to see you. There's this little cameo.
Yeah.
That's awesome.
What up? What up?
All right. Respect.
Yeah.
I got him finally.
So you had an endless runny nose.
Yeah.
With spinal fluid. Are you kidding me? That's like from a horror
That
show.
would scare, that scare the living.
Hell? What did you do?
Bleep out of me.
It's not my fault. It was a birth defect. It's not my fault.
Hell no.
Leave me alone.
Hell no,
Shoot.
It's not your fault. Nothing to ever be ashamed.
Nope.
But what did you do with just being scared about it, you know?
A lot of over-the-counter meds. That made it sound bad, but that's all I had was just, Excedrin migraine, or I got prescribed a Meatrix, which a Meatrix wasn't really touching it.
Mm-hmm.
I was constantly fatigued. The exhaustion was just bad.
Because it's trying to make more.
It's just...
Yeah,
your whole body is what's going on.
In between the shoulder blades and all the way up to the neck, it was constantly achy, spasmy, and I was going to a chiropractor, and by the end of the day, it would go right back to how it was.
Oh my word.
And this is, so there's a leaking of some kind. Was the leaking coming from the area of the brain that you had to get surgery on? Is that where it had kind of the membrane kind of protrusion, leaky thing?
He does a better explanation than I do.
Of what?
What it
was and what they did to fix it?
Yeah, please.
Okay. Yeah. So, to start off, as she said, it was a birth defect.
Right.
So, as you may or may not know, when the human body is formed, your skull is actually in pieces. It's not one whole solid piece.
Right.
Usually solidifies and fuses together as one. Well, hers in the front here, it instead of fusing solid, kind of fused with like a little cliff, if you will. And the best way I can describe that, it's kind of like a bone spur. It had a little spike to it,
Right.
And just a minute. Which in over time, another fact is so that being said, your brain pulsates with everything you do, just like a heartbeat, and under stress it pulsates harder.
You're right.
So my theory on what I think happened, why it was this long before it actually happened, anything happened to it, I think it was they say that over time the pulsating happened with the puncture happened because of the pulsating. I think that with her TN happening and all that stress she was under and all the the pain and anger, I think the brain was actually pulsating so much harder that it was hitting that sac to the point that it punctured.
Yeah.
Oh, okay.
The defect, it had a channel for the CSF, for the fluid to go through, and well, that's what happened.
Oh, okay.
So when they found that, in order to fix that, the surgeon had to go and make the rainbow cut as you see here.
Yeah.
The incision, and I referenced the movie Face Off because that's pretty much what they did. So they had to peel.
They had to peel.
They had to peel the face down to expose that where that leak was. Because right here is on her forehead is where actually the hole was. So the surgeon then proceeded to cut a chunk of her forehead, peel that off, and they had to lift her brain out so they actually put sutures or stitch the membrane up. Yeah, yeah, yeah. And they had to tuck, and before they tucked it in, they had to hold the brain up, and they had to file off that point to make it
kind
smooth.
of the spur.
And they put the,
Yeah.
yeah, exactly.
Yep.
That caused the puncture.
But then they still had this gap, so they filled that with bone cement, whatever the hell that is. They closed that. They closed that gap.
How can we even laugh? Oh my gosh, bless
So
us.
sorry.
That's all good. So they tucked the brain on nice and snug. They put that jigsaw piece back in, and then
Yeah.
used more of that bone cement.
It's
And
insane.
the only thing that bothers me about this whole procedure was they didn't tell us about the plate. We read about it. Reading those papers, from what we understand, not only did they cement it closed, there's a plate in there somewhere with a couple of 10 millimeter or 10 millimeter screws, whatever the heck it is. It's always a 10 millimeter. You can never find a 10 millimeter when you need it. You know?
Crazy.
Sorry,
Yeah.
I can't help it. Anyway, so they patched it all up, put her face back up, and sewed it all together. Oh, they also drained, while they're in there, they had to drain her sinuses as well. So that's another procedure they did. So that was another reason why this is all inflamed.
Yeah.
Another reason for the blood. They manually drained all that fluid in there.
Wow.
To see if it would fill back up. Because that was another thing. If that filled back up, that means this was a failure. And they'd have to go through another procedure where they'd, again, tear that all down. And they'd scrape out her sinuses and then plug it that way. And thank God it didn't happen. Oh, thank goodness it didn't happen that way. So,
Yep.
you know, because if they did that, she would lose 92% of her smell, which also means she would lose a lot of her taste. So everything would be bland. If you garlicked it up wicked bad, she'd be like, oh, a little mild from what they described it. So she would that's just a living hell. You know what I mean? No more chocolate ice cream, no more pizza, no more Taco Bell.
Aww.
You know what I mean? Come on. You can't live like that. So everything was a success. But after 50 staples later, the swelling was down. As some people may have seen during the follow, she did swell up pretty gnarly. But she's here now and looking fantastic.
Oh, it's amazing what you what you had to just him describing in more detail the amount of work they had to do to just patch you up. That's insane.
Because then that means that the picture that I seen where part of the brain was out wasn't like a growth or like a defect in that sense.
Was that after surgery?
That was before surgery when they discovered something was there. But so what I'm understanding with his explanation is that your bone had caused the ripping, and then part of your brain had kind of pushed out from the membrane because it had ripped what was keeping it intact. That's what was going on, right?
Luckily, her brain
Does that sound right?
Protruded out. Her brain never actually protruded out. The membrane sac was punctured and it backed off. But every time it throbbed, the fluid that keeps your brain from touching the membrane in your skull, every time the brain pulsated, it was like pumping like a squirt gun out of that puncture hole.
Oh my gosh!
And that was all thrown between the membrane and the skull when finding its way out through that channel.
Yep.
So
what was the mass? What was the little mass that you could see? I remember seeing like a visual.
There was a pocket of fluid.
Huh?
There was a black pocket of fluid that was there, and then there was a space between the membrane and the skull that they would zoomed in on. And then down here, if you looked in that picture, there was also, you could see a little mass. Again,
so it was just kind of increased because of the liquid and the. Oh, okay.
And that's why when when you bend over, that pulsating it increases. Yeah.
Like
Holy.
Yep. I can't bend over for that reason, but because it causes more pain when it pulses more, it causes more pain to the nerves. So
now, even though you've got the scarring right here in the front of your head, and people are thinking, okay, that was drastic surgery. What's it like to look at that and to know that that's actually minor in comparison to what he just described. If you were, I mean, what's it like knowing that someone took apart part of you like that?
So someone else saying they have trigeminal neuralgia as well.
I mean, that just must be surreal to just know that whoa. What?
Someone's saying they're muted on your live.
Why am I muted on Jessica's live? Oh, Kim Shell 4. Did she get muted on an accident?
She probably did.
Well, if you have any questions for her, we'll be happy to ask her.
Yeah, I don't think I'm sure that's not on purpose. If you have a question, then feel free. We can ask it. But and she's looking into it. But
if it was just
anyway, you don't have to answer that. I guess my comment is more of just an awe. And that's just so inspiring. I can't imagine
the amount of work that they had to do.
I can't.
Oh, wow.
Just
doesn't it trip you out a little bit that they peeled your face?
That's not kind of what I'm getting at. I mean,
your face
somebody lift my brain up. I mean, I didn't want to get too weird on you, but I mean,
I would have been like, once you put it back, that's not tightened. We're having some words.
Yeah.
My main concern, and it's always been, is get rid of the pain.
Yep.
You get to that point where you've done the medication, you've done the procedures, you've tried this, you tried that.
Yeah.
And they found a diagnosis. Okay, what do we need to fix it?
And they fixed the leak. They fixed the leak. They shaved it down. That must be a relief in feeling like that. Yeah, that was hell to go through, but now life's more copable.
And it sounds like it's going well, that they may not need to go back in to scrape your... Good.
Yeah, because the skull's not...
I hope that
the skull
continues.
is formed, right? And so it was the condition...
Well, because they had to scrape down inner sinus cavities, I guess. Because that was puddled with liquid too as well, I assume.
That was the second procedure. If this procedure failed, they would have had to scrape the sinuses, but they did not have to do that because this. Correct.
Well, you just keep getting better. We can't be having another face-off.
No.
For lack of better.
That was the first thing he says. Like, I don't mean to be mean, but it kind of reminds me of Face-Off.
That was awesome. I don't know.
It's kind of funny because when I saw my eyes getting black and blue in recovery, my surgeon came down. I go, "Woo, what the did you do to me? What'd you do to me?"
Right after the surgery? Yeah.
You did a little more than you told me.
That's the relationship I have with my surgeon. You know, like that's how comfortable I am.
Yeah.
But to answer your question, I wasn't scared about the surgery.
Mm-hmm.
Everyone else was. To me, it wasn't major. It was just something I had to do.
Yeah.
For me to have a quality of life, really.
Yeah.
Or at least a chance to.
Yeah. Yep, I get it.
So,
you end up in these situations that are so severe. Those decisions become a little bit more easier. You know? Just, well, I have to do this. So why spend time even worrying about it as much? There's been a lot of things where I laugh at it now, but there's been a lot of things where I've kind of glanced over, like pre-procedures. Like one of them, my pain management, my current one, walked in, and I love him because he's just so straightforward and he makes me laugh, and laughter's so important to get through things. But he walks in and asks me, "So can I stick a needle?" He said, "In your eye," and I'm like, okay. You know, he's like, right now. And he brings the kit into our, you know, I'm thinking, are you going to take me back to the procedure room that they have, you know? No, he brought it right into to our little room there. And it's a decent sized needle. But he was testing to see if he could get, instead of, because normally in the past they have tried burning my nerves, you know, in my spine. And that didn't work out well, especially since I woke up in the middle of that. So then he wanted to freeze, because around the eye, you can't do the burning, obviously. It's too dangerous. So he wanted to freeze them and see. But he wanted to test it. So Rex is next to me. And he just had me close my eyes, and he stuck this pretty good sized needle
eyeball
in between my eyeball and my brow bone. And he had to like push hard past all that scar tissue, and inside my head, I'm like, why does it sound like you're crushing glass? And he said, yep, that is your scar tissue. Have you heard that? It is the weirdest, but he was pushing hard. And Rex is next to me, and I've seen this expression so many times now where he's like, the hand over that he's trying to keep his composure, maybe a little white. He's almost passed out.
I don't know if Steve's queasy, but I'm queasy. I mean, you know, you don't come always equipped with everything you need for all of this. You
and
just
to
gotta...
me, I'm like you, where it's like, whatever you have to do, you know, whatever you have to do it.
I actually understand that sound because last year, so after MVD, when the pain really came back, it was, instead of by my jaw, like right here, it was at the top of my head. Ooh. And it was really bad that when I went for a follow-up to see the surgeon, they immediately brought me down to the emergency room because they thought I was having a heart attack or a cardiac arrest. My chest was really hurting and I was having a panic attack. But as soon as they gave me the pain meds, I calmed down. So they're like, okay, we're going to recommend gamma knife surgery or procedure. They call it day surgery, but so I had that done, and it's pretty much radiation treatment, but the way to do it is they have to do 4 bolts into your skull to hold the frame in. And they put lidocaine a little bit.
Was it like a halo frame? Or was it different?
Halo frame, the boss is saying.
4.
Oh, okay.
4 points.
Okay, yeah. So I know exactly what you're talking about.
2 in the back, yeah. The shot that they give you goes really deep.
Yeah.
That one got me sweating. He's like, oh, do you want me to wait? No, keep going, just get it done. That's what it was. And then that's when the bolts started, and you hear.
Yes.
I'm like, what is that? Don't worry about it, you're fine. And then afterwards, he shook the frame. I'm like, you mind?
I love how she shakes.
She's shaking the phone at the same time.
That was such a great
effect. Did you guys all get that effect?
Was such a
We're
great
right there
effect.
with you.
We're like,
Jess.
Oh, shoot.
And then I had to do a CT scan with the frame on. That was about a 30-minute scan.
That had to have been brutal. Trying to lay there like that, or I don't even care if your neck was. And the reason I know about that is my brother passed away years ago, like 2 days before his 37th birthday from cancer. And so he, you know, part of the radiation, they'd have to put that frame on him. And I always just, you know, he'd come out with the holes and.
Yeah. For my treatment, it was 75 minutes in the radiation area. That was the easiest part, was the radiation part itself.
Right.
But where they had the bolts, it was trigger points. And I tried telling them that. I said, these 2 points are triggered. Again, nobody listened to me, and I went in the ER that night.
Oh, my word. Yep, it's so Like, I won't, when I was having my Botox regularly, like every 4 months, if I was having a flare up, I would cancel, because I knew that her putting a needle in nerves that are actively, intensely angry was exactly going to do that. I would end up in the ER, and then I would have days of just trying to recover. So
Yeah.
I get that. That's brutal. It's brutal. But yeah, the crushing glass is kind of a gross.
There it is.
Oh my. Okay. Oh my word. Rex is probably excited. She looked kind of like one of his cyborg
Holy
movies.
shit. We're talking Marvel shit.
Sci-fi. That
You
is
look like a
like
superhero
I
villain,
know.
something.
A villain, maybe.
Legit. It looks like the Winter Soldier.
What
Oh, thanks
in
a
the
lot.
hell?
We're just saying you have a future in the
That
movies.
is badass.
Okay, hang on. He's got the side.
That's
What?
insane. Oh, that's
Are
insane. You gotta be
freaking
joking.
kidding me?
Oh, all of our respect. I'm serious.
You guys, if anything
No way,
happens
no,
to
no,
me,
no,
I'm
no.
the support. I'm this caretaker
I
support guy.
It's like, I love my role. I love my
I am
role.
such a. I'm telling you,
And then they put her-
I cry over if my feet's cold in the ER. I can't handle it. You guys, if anything ever happens to me, you're gonna have to.
What is that over? So they put a kind of a okay. You got
to measure the laser points.
Oh,
so what he's doing right there is
word.
measuring the laser point.
Okay. Yep.
And what was it? Why were they doing this again? But what?
Make sure it's all precise and get the accurate measurements.
So for radiation, they're making sure where the laser beams are gonna go. They're
because her
measuring
pain
my head.
changed and went from the side of her face to the top.
Oh.
Yep.
That's insane photos. That's incredible.
It's my journey. I want to keep track of it. My battle scars, you know?
Yeah.
Legit.
That's why she just sat there like nothing, having 50 staples pulled out. Like, And
we're proud.
What's for lunch?
We're proud. What's for lunch?
Apple juice.
Yeah. Let me get my Mountain Dew.
I know.
Just another
I
day.
always try to get a little treat
Another
after
day in the
a
life.
procedure.
Let's go for a walk now.
Well, actually,
no, heck no.
No big
I'm
deal.
not going to be like, let's go for a walk, go for lunch, and get me to bed.
Yeah. Or whatever, you know.
Actually, some of where the staples were on this side, they're on my points. And I was trying to tell them in recovery. Now, mind you, all the lights were out. They had to find me a box fan in the hospital.
Yeah.
I was crying for pain because they're trying to give me just 2 oxycodone with 3 Tylenol every 4 hours. Yeah. That's a long time.
Yeah, it
4
is.
hours. And I was having
that
a
was just
flare.
The first night, not even.
Yeah, women are tougher. Curly dog, that's for sure.
And then after that, they were just trying to give me straight up Tylenol.
Oh, no.
And avoiding pain medication, they tried giving me Ativan, Benadryl, Tylenol, and then there's something else they're trying to give me just to avoid giving me pain medication.
Yeah, I was going to say, that's a lot of meds, but I don't hear any pain medication, really. Yeah.
This girl spoke up. The surgeon came down the next morning, visited me personally, said, okay, we're going to change this, and he did. But, my cat's attacking me. The main thing is you can't be afraid to speak up.
Yeah.
It takes time to build that warrior shield.
Yeah, it does.
After many experiences, but especially during COVID, I was forced to do a lot of advocating myself.
Yeah,
and that was hard. But when you feel like you can't do it anymore, there's something in you that just gives you that push.
It's
that's
you're right.
That's exactly what happened to me. Nell had gotten denied. and she was in the worst despair that I've ever seen. And she's one that is hopeful and has faith, and I saw her just broken, and
Yeah.
I was I I was just that was it. It was the next day that Misty Marvin sent that video, and I duetted it, and you guys could see that on my post. And I was just bawling, and I was remembering her and what she had to go through, and I was done. I was like, I don't care. It's not about me or what people think of me or worried about if I put something out there. I have to do more. I cannot feel helpless and be aware that this is happening, and then just have, and not that I want to like make light of people's lives, but it is hard when you're seeing TV and grocery store or wherever you go practically. It just seems like they're not going through the same thing, and that they've got hardships, right? I want to be sensitive to that.
Right.
But at the same time, I'm also seeing things, in stark comparison that is different. I mean, it's not like I'm seeing, if I'm buying groceries, I'm not seeing what I experienced the earlier day. So, you got to also at the same time give credit to the fact that we're going through some hell, and I want to do something
when he
more
says
than
denies,
just,
or denials, we had, so advocating for myself, I like a lot of you, spent a lot of time really thinking outside of the box. What does
Missy.
Misty, did you say?
No, Missy.
Oh, okay.
Missy.
Hi,
she
guys.
just stopped in to show love. Sorry.
Thank you. I needed to think outside the box because their last effort and attempt was to try to get me to ketamine treatments. And I was denied over that because there's just not, the insurance didn't feel like there was enough research done, and it can be dangerous. But it's like, well, I'm already in quite a bit of danger. What started happening to me is motion stopped. Literal motion, other than getting up and doing the absolute, because like you said, the bending over would start things. Light, heat. People don't realize how many
triggers
in just 5 minutes, how many muscles you use in your face. And when you have nerves that are going crazy in your face, it does not take much. I have a special $100 and something pillow, and we searched, and it gives me just enough support, but so that I'm not falling into it, but also doesn't push back. Mm-hmm. But a pillow can trigger, you know what I mean? So anyway, I started really thinking, okay, now this is really affecting my body, because I have bone deterioration starting in my shoulders, and of course their suggestion is, you need to start exercising those muscles. Well, that's great, but that triggers things. Again, I'm trying to say. And so then what happens is, and I'm a very picky eater, don't eat a whole lot, but my body naturally gained weight. Yeah. So my body responded with gaining weight, because I would have to damn near eat 200 calories a day to not have it with the little motion I was having. And so I sent my primary care doctor an email, who he is just, I consider him very close, almost family too. But he immediately agreed. I suggested lap band surgery, because my body needed help that I couldn't give it. And I needed something to relieve, because as you gain weight, that starts pulling on those nerves. And I've got messed up nerves in my neck, my right neck, and my left eye. And then then when one's angry, it travels, and the other one angry, so then my whole entire world from my shoulders up is pure agony. Mm-hmm. for days. And so anyway, they denied, he was on one insurance. They denied the surgery twice.
And then we got
because I was right on that. I wasn't like super overweight. So they were like, what do you need that for? And I spent a lot of time writing letters. I had my neurologist on board. I had our pain management on board. I had my primary care doctor on board, and I had the surgeon on board. They didn't want to listen to any of them.
Even with the new insurance, and then it got denied.
Then we got
2 more
new
times.
insurance,
Yeah.
But not only did the new insurance deny it twice, so there's 4 denials. They took away my triptans, which are crucial to me. So most people get like 9 triptans a month because I need those triptans in conjunction with other meds, and I have to hit it all hard. But for me, I get about over 40. I think it's over 40 now a month. So that tells you something.
Oh, well, the trip. Yeah. Well, ironically, without it being through the insurance.
But my point was, is they took triptans away. They took my Botox away. I mean, this new insurance just was ripping just things that I was even used to having. So not only were they denying what I knew my body needed. Luckily, I have amazing family. They immediately put together a fundraiser and was able to raise enough for me to get the surgery. And sure enough,
how much have you?
Well, I'm down 30-something pounds in 2.5 months.
Yeah.
But
Wow.
absolutely, it was the right decision. And I haven't been able to exercise even a lot yet because I knew it wouldn't cure. It's not going to ever touch my pain.
Yeah, that happened without.
But I couldn't fight both of them. So when Rex said I was in despair, it was because the exhaustion level was at the greatest it had ever been in 9-10 years. Yeah. I could feel my body shutting down.
Like she was going to die.
I cannot do this. I can't do it anymore.
Like if something does not change, right, then I will be in serious trouble. I will either be advocating stronger than I have been because she passed away, or because we really, or I'm going to be advocating. Mm-hmm. Trying to go down a path of drastic recovery of some kind.
What was like 2 months I didn't move from my bed other than to use the restroom.
Yeah, it was just...
Get a drink. I couldn't. You feel like you're 90 years old. You've probably felt that before where it's not just... at least from somebody that suffers with facial and head nerve pain. And there's different layers. Yeah. I love how my neurologist explained it. She said, you're not just suffering from migraines, but there's the cluster headaches and the tension headaches, and she thinks it's all. And then you've got different layers of these nerves, and you have she calls them the nervy nerves that are right under the skin, right? And so, oh my word, those are a beast. If I do this, you guys, like a feather, I can feel it up here, just like somebody scratching my head.
I can't even kiss her in some place.
No, his whiskers, if they touch me, it is sharp pain.
Yeah, so
it ain't playing.
Part of being not just a caretaker, or just being married to someone, you have to adapt.
So he kisses my hand now.
Yeah,
just kidding.
I mean, you've got to adapt.
I'm like this. There you are. Okay.
Kiss the hand.
Off with you.
Yeah.
The ring.
Off with you. Off with you, my servant.
Tough. But you guys, it takes everything out of your body, right? It takes your whole body fighting this, your heart, your lungs, and so every day, we're looking at this amazing couple and Jessica. She's running a marathon every single day, and that's why I don't think there's a group that I look up to more. There just isn't. We're talking about the finest on earth.
That's what, yeah. I'm pretty biased too, for sure.
Yeah. So
You're gonna be
well done for just everything you're doing and everything you've said and everything that you are. And
yeah, absolutely. So
same to your
so
husband.
much love
Just,
and respect.
I know.
We love you guys.
I have respect for you guys. I mean, it was just
Means a lot. Thank you.
I saw the live pop up and I saw chronic illness and I said, okay, that immediately grabbed my interest.
Yeah.
Because around where I live, there are no support groups. There's none. There's none.
Yeah, that's not okay.
I've tried looking. I've tried on Facebook.
Mm-hmm.
I've tried even asking around, like the hospitals, my
Yeah.
neurosurgeon, and there's nothing around here. So that's when I signed up to be a mentor through the Facial Pain Association. So even when I'm in recovery from a craniotomy, I'm still emailing people
Mm-hmm.
because I don't want them to wait, because I know what it's like.
Yeah, you don't want them to have to go through what you did.
Right.
You know.
So I know hubby here is going to say, take care of yourself. But realistically, when I help other people, it helps
I
my
really sound like that? Jeez.
Take care of yourself.
It
does give back to you, huh? When you know you're helping someone else, that's the whole reason behind Spoonful of Sugar is serve someone else every day, and it will feed you in ways that nothing else can. It will feed your body physically. It will feed your spirit and your mind and your heart. And you're doing that beautifully.
It's been helping me tremendously, like mentally.
Yeah.
Because I literally, that's when I had no other place to go. And my friend said, join TikTok. You don't know who you're going to meet, what's going to happen.
Yeah.
And this was back in February of this year. So, last year was like TikTok, we hear bad things about it. So I was very
leery at first.
And it was very much, everybody was kind of following still, like, who can do this dance better, who can do. Right. That's why I was excited. I'm like, look, TikTok, not that anything's, and there's been beautiful leaders that that have done amazing things on TikTok, but I felt personally, this platform can be used for so much more,
Right.
It can make it, just like anything, you can make it what you want for it to be, you know, and that doesn't.
I mean, we can dance for you guys if you want.
Oh, we can.
Yeah, but
I think I danced. Go check out one of my earlier posts.
Rex did.
You want to see a guy bust a move? It's like one of my third or fourth posts. Go check it out. Me and Candace
right
Cameron.
In the middle of a park, and I'm like, where'd you go?
Me and Candace Cameron knocked it out of the park.
What park did you go to? Because I'm wondering who's seen him, right? And he's like, oh, in the middle of a park. Yeah. And I'm like, did anybody see it? Yeah. Oh.
Just wanted to go dance in the park. Yeah.
I mean, we could come up with a chronic illness duet dance or something.
We should do it when we have a group of people. Whenever we meet up and there's a group of us that can get together, would that not be so fun?
Yeah.
Yeah. Yes. Thank your friend for us, though, for suggesting that you get on. Because what a blessing you are. Seriously.
It was literally a chance that I did it. And the first thing I did is I just look up, instead of friends, you do look up hashtags. So I did hashtag Trigeminal Neuralgia.
Yeah.
I was blown away with how many people have it on here. And the first group of people that I found are actually are my side, and one of them's the trauma lady.
Hey.
So yeah, she has everything.
If I'm not, if we're not following you already, follow me and we'll get you back.
Yes, please. We'd
Yeah.
love to get to know all these people that are special to you.
And send emails if you're interested in being on the show to rex.nell@gmail.com.
And we are going to be doing more of them because
She wants to do more than once a
we
week.
need to.
You know, even though we're starting to book in March, and I know that's kind of far out, and she wants to do more than twice or
I want
once
to
a
do
week.
3 because one of the ones I want to do is just lives where we play games and win prizes, and we are giving away one today that I'll mention at the end of this. But it's one of my favorite. And then don't forget to send your address to us, Jessica. And some of you, I need a mailer. I need someone to pack stuff and mail it out for me.
You need an employee.
Things they get behind sometimes, but
I guess that's me.
We'd like to send you guys something. Anybody that's on, we love to send a small gift. But
that's another
I'll
me
show
task.
you right now. So I talked about spoonful of sugar. I'll just do it right now. And what that means to me as a spoonie. And I got this ring, I want to say, about a year ago from a company called Brian Michelle. And this ring is one of those stamped rings. It's gold plated. It's beautiful. It's one I wear it every day. But it just says a spoonful of sugar. And it's beautiful. And it actually moves with your finger. You see that movement? So it's very comfortable. But because I just had my 45th birthday a little over a week ago, this is what we're doing as a drawing tonight for one of you to win. So, that's very special. That doesn't move. So that'll be at the end of this. And what's nice is these all get recorded and put on Facebook. So any of you that didn't get the whole thing, go back and watch it whenever it's convenient for you, and all the others we've done. But it's good. So if I call out your name and then later I'm like forgetting, I can just go back. It is nice for me because I can go back and go, okay. So don't worry about being forgotten. Thank you guys. Yeah. Actually, I celebrate my birthdays with a whole new outlook because the tumor that I have is an ugly one and it can turn at any point. So I honestly for probably 9 years didn't think I would make it to 45.
Yeah.
So 45 was a big milestone.
Mm-hmm,
but
sure.
I'm excited for whoever gets that. It'll be really special. But for you, yes, we have something for you guys. So make sure you email Rex your address if you don't mind.
You're calling me a warrior, though. You're a warrior.
I am. See, I never feel comfortable with that. I meet you guys and I'm like, oh.
Yeah, these
people are putting me to shame.
I always call her my beautiful badass.
He likes that word.
Oh, and a beautiful mess, I think.
Yeah, that's fine.
She's a beautiful mess.
I'm absolutely a mess. We can agree on that.
Hot mess. Ha! See? Now you're talking my language. You got a hot mess over here.
And I go, no, I'm just being a biatch.
No.
Yeah. Well, some days, I know you understand, Jessica, and a lot of you here in the chat, our fuses are shorter than we would, and it's never, my heart immediately hurts when I say something that might hurt him or do something where I'm short, and it's, in the state of pain and exhaustion. And so all of you out there that are supporting, Please forgive us, and please know that. And it's really not us at that point. It's a different. Yeah. It's his own beast.
Yeah. Cut him some slack, for crying out loud, you know.
Yeah.
I call it my pain personality.
That's exactly what it is. Well, now I'm going to start using that. And I'm going to say
personality. I like that better.
I'm going to start saying, well, Jessica told me it's okay to say that.
We're just having my pain personality right now.
Jessica does it.
One moment, please, while I change my personality right now.
I just kind of now I'm like, look, you're going to. So, you guys, this is one subject that we brought up before, and some people it's a little bit like, huh? How do you, what? So we have separate rooms, very much married, very much in love. I have to have this room so cold. And then also, one thing that helps me get my mind kind of off my pain is I watch, my favorite thing in the world is documentaries and history. And that will go on day and night. Okay, see? Because you guys, we cannot imagine any of you who did, you know, are in here that are just learning. First of all, thank you for being willing to sit with us and learn a little bit more about it.
Yeah.
But to lay with a pain that is a 7, 8, 9, 10 in the dark and think that you're going to have regular sleep like someone else, it ain't happening. So for me, I need that, and I might as well be listening and learning, and it's comforting to me. And he likes his room very warm and dark,
quiet,
and very still,
peaceful, zen.
Yes, and so, and honestly, it's his escape. Sometimes, you know, it's okay, and I'll say it's okay for you to go into your room.
Yeah, it's okay to couples to have their own space. I mean, she even had to share a room her damn whole life. You know,
First time ever I've had in my room. I have 8 siblings, so I was like, "What in the hell?"
So you make up your own rules. Make up your own rules in life. You know, you do not have to go through life.
There are marriages where they don't
at the societal norms, and if you don't fit in it, that something's wrong. And you gotta
That's why I bring it up, because it's not normal. But guess what? Yeah. We don't live a normal life, and we don't live.
Yeah, figure out.
We have to work.
Figure out what works. And
works for you and your
don't give a shit
and your people.
Other people don't like it.
Yeah, but it took a while. It was interesting because of, you know, you worry about what other people are going to think, and it was a while before I finally, I think it was first on here that I just was like, you know what, and I want to share something, because I think some people were kind of wondering. So I would say my room, you know. So for my birthday, Rex helped.
Make it all nice.
We'll show you. This is Yodel the yak back here.
Well, she spends most of her time in here. It better be.
I've dreamt up my room, all the colors, all the decor, and for my birthday, he really worked his butt off to make it. Because this is where I spend at least 70% of my time. And when our kids come with their significant others and our little grandbaby,
it's fun to gather in here.
It's big enough for all of them to be in here, and they will come up here if I can't go down to the main level.
And we can have sleepovers. Do you guys have sleepovers?
Oh my gosh.
So I mean, it's cool. It's like, hey, you know. Anyway.
Yeah.
Our child isn't grown up yet, so.
Oh, there you go.
Yeah. So ideas for the future.
Yeah, you've given us that idea, but we're definitely not the ordinary marriage couple. But that's okay.
That's all right. That's what I'm saying. That's what I'm saying.
I love it. I love the diversity.
Yeah, exactly. You know? That's what we're getting at. We're sharing a little bit of our diversity.
Yeah.
And how there could be positivity and health still with that. Right. And you might relate with some of that. Both you, as well as the viewers. Maybe you don't. Maybe that helps you to feel like you can give yourself permission to find out. Isn't that's a lot better than some of the other alternatives? that other people are
So
deciding.
Jessica, I like this comment. Someone says, "I call it pain Tourette's. You say things, you say things random, yet you can't control it." It is
pain Tourette's.
very much like
Curly
that.
Dog's
That's
saying
so
that.
good.
She's saying she relates.
It is like having Tourette's. Like, ooh, shoot, that came out. Whoops.
Yeah.
Well,
Sorry.
I like to have nicknames for the diagnoses I have.
Yeah.
So like the end, there's a video where I'm like, help me for a nickname for encephalocele. But the first thing I say is, my TN personality is Thelma.
I love it. I love it. Yeah.
My TN is like full gear. I go, hey, Thelma's coming out today, guys. Just let you know.
Yeah.
Oh, yeah, he's like, oh, shoot. How long do you think she'll be here?
That's funny.
How long is she going to stay? I've never come up with a name, but I do for everything else. I don't know why. I love that you just said that because I don't know why. But in my head, it's very female because, quite frankly, it just fits. Like, I'm first. You're going to listen to me. And I'm yelling the loudest. And to me, it's just like quite an aggressive female. We said this last week, I think, when our daughter was younger. We tease her now, but she came in and I was kneeling on the floor because sometimes it's so bad you don't even know what to do with yourself. So you're on the bed, you're kneeling on the floor, you're in the bath, you're out of the bath. You just don't know what to do. There's just not. You're just trying everything. Desperation, right? So my daughter, who was maybe 12 at the time, she comes in, and she's the one, our youngest, who plans on going to paramedic school here soon.
Mm-hmm.
But she comes in and she says, "Mom, you're like a superhero, but backwards." That was one of the hardest times I've laughed in my life. Because I'm like, I'm a backwards super. She's like, your nerves are so extremely strong that they don't know what the right thing to do is. And I'm like, yeah, I guess I am kind of like a backwards superhero. I'll take it.
That's a good one. I'm going to use that.
I died. It was she did not know how else to say, you're messed up. I'm concerned.
It was her kid's version.
But I respect you. You know, it was just all of that rolled up into that little explanation. Oh my word! And she made me laugh in a very, very, very hard moment. So,
see, that's the other aspect for me, because I'm a young mom. I'm 32.
Yeah,
we're young parents.
Mm-hmm.
20, and I got diagnosed at 29.
Yeah.
And every year after that, I've had a major, surgery or something like that.
Yeah.
So between then, I'm in bed, or I'm moody, or I'm very snappy towards her, or she has to go over to her grandmother's because I just can't do it. And then it's the spousal support that he's trying to do the best that he can, and then he feels like he's not doing the best that he can because I'm not better.
Yeah.
Oh.
And I carry that guilt because he can't do certain things, or I'm acting like this, acting like that. So that's where it's hard for me to carry it now, because it's like a suitcase of trying to think positive of, I got the surgery, I'm feeling good, so by the end of the summer we can do this, that, the other thing.
And having hope that will be what happens. Yeah.
Right. But that guilt...
the guilt kills me.
Yeah, we can relate.
That is what gets me more than anything.
Yeah, it's pretty
common. If I'm going to have a bad day and go down, it's because something's working real hard on me to make me feel like I'm lazy. I'm not a good mom. I'm not a good wife. I'm not a good friend. I'm not a good daughter. I'm not a good...
Well, and the caretakers, I'm not being understanding enough. I'm not being,
or I snapped
patient
at him
enough,
today,
or I'm being,
you
or I'm reacting.
Yeah.
You're
right.
I'm being responsive and reacting, and then now I've made it worse, and I should be better. I mean, we're talking about these kinds of dynamics, but it's also, you know, uh, depending on who is in your life, whether it's a spouse or whatever. And so again, you guys are just trying to do your best to manage that and have it be okay, and have you guys both.
To me, it's like walking into, if I step outside of myself, it's much easier to think about it, but it never fails to amaze me that how guilt can always get me, no matter how logically I think about it. Like if we walked in the middle of war and there was chaos and killing and pain, and we would not be like, excuse me, did you say please or thank you or how are you? We would not be. And it is such, it's our own war we're going through with our body.
Battle, yeah.
And we get so hard on ourselves, and I'm talking about the person that has that physical or mental or whatever suffering, and the people that are sticking around with them.
Yeah.
If it were, World War III, we wouldn't be checking each other like how well we're doing, how well we're surviving. And it absolutely is a very, very real war we're fighting. So we got to cut each other some slack.
Yeah, you do, yeah.
Then what happens?
And then
is every day I feel that guilt.
Well, and I'm talking, and cutting slack also goes, cut yourself slack when you didn't cut someone slack. I mean, literally, it's like, if you didn't cut someone slack, don't like beat yourself up over it. Cut yourself some own slack. I mean, really, you need to.
Well, when we talk about spoonful of sugar, I've said, it's one thing to serve someone in whatever capacity every day, because it will feed your body, your soul, your spirit, your mind, everything. But there are going to be days where you need to, that spoonful of sugar, that last spoon you have, you've got to give it back to yourself.
Yeah.
You've got to serve yourself and say, I need to care for myself today so that I can continue being, a better spouse, a better mother, a better whatever. We just need moments ourselves of like, my word, we've just run 5 marathons this week, and however that looks for you guys, whether it's, I don't know, it could just be even talking to yourself more softly, or doing some things that you love that you just push to the side often. But take care of yourself.
Yeah.
Take care of yourself.
So many lives could be saved if we change our relationship with guilt and shame.
Oh, my goodness. And if we remember each other, which is the whole, because, there may be actually, I think someone said, it's my first time here. The reason for us starting Spoonful of Sugar Foundation is so that we can bring, it's nothing major. We're not the ACPA, for goodness sakes, even though, we've been in talks with them about things that hopefully are coming up, and they've got an amazing group of people and have done quite a bit. Rex and I, our aim is to bring things into people's homes in ways that because of what I lived, I hope that I understand you guys. And so, some of our ideas are different services. Like, meal kit companies or gift cards or beautiful flowers because maybe somebody hasn't walked out of their house for a couple weeks, or, you know, and so those are the ways, besides these lives and the little giveaways we'll have on these lives, that we want to physically say we love you. And you may not even ever type a sentence in our lives, but if you're here, you're here, and you matter, and that is our goal. Besides that, we want to be able to eventually travel to see you guys. That would be, I think, the pinnacle
Amazing.
of it all is to actually see you guys and, you know, sit next to you and act, you know, give you those hugs that we can't from here. But
our first Laurel Lingle, our first, she's the first one that we interviewed. She was our first special guest. She's just joined us. So
hi, sweet lady.
Whether you're still with us, we're going to be wrapping up here in a little bit because I know it's getting pretty late where you guys are. But whether you're watching this on YouTube or whether you're still with us, again, just a reminder, please go follow, give some love to Facial Pain Warrior and Laura Lingle. Anything else that you want to say, just kind of as we get ready to close here, that, you know, if this was the first time that someone was getting to know you and you wanted to just kind of send a message, what would that be, Jessica?
We always ask the heavy ones at the end.
Say that again.
You're not alone. Don't give up. I know that it's going to get times where you just really, really want to give up. So what I actually tell my followers is don't let any doctor tell you how you feel. Mental or physical. And as much as you look at the depressing thoughts of, oh, I can't do this, I can't do that, I can't do that, it's more of accepting and adapting, which is the hardest part of of your new life.
Exactly.
If it is going to be. And small victories, like I got out of bed today.
Yeah.
I was able to do the dishes today. I was able to shower today. I got outside today. And those small victories are eventually going to help this a lot more. And I may sound like I know what I'm talking about, but it's still, you know, I'm still learning it too.
Mm-hmm. Yep.
So
that's amazing. It's amazing advice, and it's so true. And I think we can help each other as we continue to repeat this all the time. Give yourself credit for every little thing you do, because you're already fighting quite a war that many people will never be asked to understand. And so be kind to yourself.
Yeah. Don't underestimate yourself.
And as Jessica says, listen to yourself. I know sometimes it's really hard when you're in front of a doctor who has it can be intimidating, and they're telling you how you should feel, or they're telling you what they believe. You listen, you know your body, you live in it, you have intuition, and they're gifts that need to be called on more. Don't let anyone tell you what's going on unless you agree. If you don't agree, then I say reach out and say, I need help. And we'll do a whole nother live where we call upon followers to see if anybody can help. You know? So we're all here. We're here to serve you however possible. So if you need service, I think that's something I'd like to say in ending here. If you need something, we are all in here a safe place, and reach out and say, hey, I'm really not doing well, and I feel like maybe my depression's getting worse because I'm not getting better, or I need to talk, or I need help finding ideas of what I might have so I can take it to my doctor. Anything at all. We, look us up. Please follow Jessica. You will be entirely blessed because of it.
Absolutely. Yeah. Continue. Go subscribe to our YouTube channel. Our links in the
Pain Warrior. Amazing couple.
On a bio. Subscribe. Follow her. Not just continue to join and follow us, but take what you've gained and take that in your own communities and join. Join the process, and that don't underestimate your own self, and start conversations in your own circles and in your own families and your own friends.
Absolutely.
Because it's not just a handful of people that are out there that are getting followed. You all absolutely can make a difference in in the lives of many people. So
I think one of the things we'll do, you guys, because this is the first time we've kind of talked about our people, the people that are sticking with us through thick, thin, hard days, a little bit better days, really difficult days. It would be fun to do a live where we really honor those loved ones that are helping to care for us.
You know what I
can
do
giveaways for them.
When we turned TikTok purple, you guys, we had a Zoom call, and we had Santa and some other people that all joined, and they were presented on our wall monitor.
It would be fun to do some really cool gifts.
Quarterly or something like that. Wouldn't that be something to invite all of the guests and have them all on one screen and be like, hey, you guys are the veterans.
Something that we can do. I think quarterly is perfect because
that'd be
I think each time you'll see that number grow.
I love that idea. Yeah, and so we'll be in touch. This is
because you guys need a support group just as much as we do.
Yeah, you're not going to get off the hook.
Laurel's saying to you, Jessica, I hope she recovers and finds relief.
Oh, yeah.
As we all do.
Yeah. Laurel Lingle was our first guest, and she just heard me say that. She's like, that'd be great. Yeah, and I think so too. So I think that's something that we for sure have just decided. That's something that we're going to do. We just have to arrange for the day and announce it. But having our past guests quarterly all the way up through that quarter, all on a Zoom call, that'd be awesome.
Yeah.
So we'll have you back.
Oh, for sure.
The dance Rex, the Zoom call.
What was that?
We're gonna do that dance on that Zoom call.
Oh shoot!
Hell, we'll be fine. Yeah. You'll get all of us doing the same jig.
Don't get Rex going. He doesn't know when to pull the plug.
Watch me get all sorts of videos with recommendations. Rex.Nell's gonna get blown up with different jig recommendations.
I mean, I'm sitting here literally thinking, are we gonna be able to actually film all the moves he does? Because he likes to break dance and pull these breakdance moves. And then what happens is he gets reminded about his age very quickly as he's hyperventilating. Yeah.
I'm in pretty decent shape, but I can't move like I did in the 80s.
And do splits.
The Michael Jackson days, when you can...
The Michael Jackson days aren't so smooth.
I grew up in the 80s, man. I mean, you might as well beat it, because this is a thriller. Because this is a thriller.
Can you imagine getting a video of all of us with all of our different limitations? I'll be over there going... with hands. He'll be jumping everywhere.
Somebody just said on mine that you can do parkour.
Yeah, parkour.
Oh my gosh. It would be amazing though. It would be amazingly funny and just a relief, you know what I mean?
Yeah, absolutely. Good times.
I do want want to say, as far as the caretakers, the Facial Pain Association has virtual meetings for caretakers as well.
That's
That
cool.
is beautiful. So you guys heard that?
Yeah, I know the American
Please.
Chronic Pain Association does something similar, and that's neat to know. I'll have to look into that specific, because I know that there's some main ones. I'm sure there's smaller, different support groups and different things, but you know, some of the big players like the American Chronic Pain Association and what you just said, they're obviously more further along and more you know, organized in terms of support.
But I still want to go ahead with it with us because I just feel like this is absolutely a family to me.
Yeah.
And so
yeah. Well, you need it all. You need it all.
Getting to know each other.
Bigger
on
companies
a
like
basis.
that. In fact, that's one of the reasons why they're interested in working with us, is because sometimes you can't get at the intimate level when you're, you know, I mean, they've got YouTube videos and they do a lot of different things, but you know, are they able to maybe reach at the home level with everyone? Maybe not, right? And so there's a place for everybody. You know, so.
Yeah, absolutely.
A lot of the groups that they offer are run by doctors that offer their time.
There you go.
That is amazing.
Yeah.
That is amazing to hear.
Yeah.
Thank you for sharing that.
Actually, anxiety and handling chronic pain. So I'm interested in that. I'm going to go into that, and then I'm going to be sharing my information on TikTok.
Okay. That's amazing. Cool.
Yeah, yeah. And
Laura, I don't know.
Laura, I'm not sure.
I would assume ACPA does have a hotline for support.
ACPA, if you're talking about American Chronic Pain Association, I think that's what she meant. You'd have to go and check online. They've got some different sources of information there. That's probably going to be the best to answer you, you know. But I think that they have a way to find a local group in the area or something. So.
Yeah, Rex and I are. The most difficult thing about starting foundation is, you know, obviously your mission statement, and I'm struggling to find words to do it justice, while at the same time explaining that our aim is very simple but very needed, because this way more people we can physically get to them, whether it's something we send through the mail or something we hook them up with to help their life a little bit easier. And I think we're hoping to partner with some of these groups because we offer something a little different. And I know it sounds very simple, but I think all of us who you know, suffer know that the simple things mean the most usually.
Well, it's collaboration. You know, I say before we even changed the post here to the spoonful of sugar, you know, formally, you know, people that remember the three, you know, kindred spirits join the conversation and stronger together, and that's what collaboration is. We're stronger together when we have any kind of collaboration effort going on, you know, and
we're so blessed to have you two on board. We're so blessed to have you be part of the family.
Yeah, we love you. It's exciting.
It's an honor to be linked with you.
Yeah, we'll have to keep in touch.
Thank you so much.
We'll have you back on that Zoom call. We'll have to get that arranged with our first quarter, but we'll be in touch, my friend.
And with the giveaway, you guys, I think it will be. I cannot wait. Rex laughs at me, but I can't. So, you know the fun spin wheels like Vanna White did? Whatever. Did she do that?
Something like that.
Or wait, did the people do that? Never mind, Vanna just went like this, I think. Anyway, I have spin wheels and stuff.
I have a Wheel of Fortune.
So if if you guys come up with some fun games, we definitely want to play. We want to do our lives with just nothing but games sometimes.
Yeah.
And so
mix it up. Yeah, she's got some fun ideas.
We're putting all your names in, all of you that have joined tonight, and we'll be on another live where we're going to spin for the winner of this ring, and you will love it. But yeah, Jessica, please send your address to us so we can send you something.
I do want to say I appreciate you and thank you for even getting out of bed to talk to me. I know
You
you
too.
weren't feeling well.
You too.
And I think you're a badass for doing what you're doing. Both of you.
Same with
thank
you
you.
guys.
We really
The
appreciate it.
sentiment is exactly the same. Thank you.
Yeah, we love you guys. We hope you have a good night, and we're just honored to know you. Thanks for joining us, and watch for this will be posted up into YouTube probably tomorrow.
Yep.
So I'll ping you when it's there, and you can refer people, do whatever you want with it. But it'll be a full interview there. So
Yeah, it's gonna be exciting.
okay.
I always go to bed with smiles after our lives.
Yeah.
So thank you for bringing that into
Absolutely.
our life.
We love you guys. You guys have a good night. Okay.
I love her cheeky little smiles.
All right. Thank you.
Big sloppy kisses. All right.
Thanks,
love you
you
guys.
guys.
Thank you.
Have a good night.
Bye.
Bye,
See
you
ya.
guys. Have a good night, everyone.
Bye, everybody.